February 9th, 2021 regular meeting of the Calaveras County Board of Supervisors. We will be going into closed session. Item 1, conference with real property negotiator pursuant to Government Code 54956.8 regarding price and terms of payment for the following property affected by State Route 4 Wagon Trail Realignment Project, Phase 1, Roland G. Shabram and Franziska M. Shabram, trustees Shabram Family Trust, dated August 9, 2002, APN 040-002-027. County negotiators are Robert Packinger and Doken Engineering Incorporated. Board action. Is there any public comment?
We do not have any public comment at this time.
Thank you, Ms. Heaton. With that, we're going to go into closed session now. Thank you. Did you get the report out for closed session? Let me know when we're ready.
Yes, I have to hold on.
Are you a chocolate person also?
Welcome to Tuesday, February 9th, 2021 Calaveras County Board of Supervisors meeting. Ms. Fullendorf, would you like to lead the pledge? Ms. Board Clerk, can we get a report out of the closed session agenda?
Yes. Report of closed session. 1, conference with real property negotiator pursuant to Government Code 54956.8 regarding price and terms of payment for the following property affected by the State Route 4 Wagon Trail Realignment Project. Phase 1, Roland G. Schnabra and Franziska M. Schnabra, trustees, Schnabra Family Trust, dated August 9, 2002, APN 040-002-027. County negotiators are Robert Packner and Doken Engineering, Inc. At this time, board action is no reportable action taken.
Thank you. With that, we'll move on to staff announcements. Are there any staff announcements? Looks like Mr. Leach has his hand up. Oh, we got Mr. DeBasilio here also. Let's let Mr. Leach, if he's got a staff announcement, go first.
Yes, good morning. I want to take a brief moment to talk about an award that the Calaveras County Public Health Department has been nominated for and awarded by the Association of California School Administrators. So this is something that occurred through the process of the pandemic hitting last March and through last year. And because my predecessor, Kristen Stranger, her name was at the top of it, I felt I'd be remiss if I didn't announce this publicly. So this was a letter written by Scott Nanick, who's our superintendent of schools. Mr. Nanick wrote, quote, "We want to shout the praises of the Calaveras County Public Health Department for their awesome communication and collaboration with education leaders during the COVID-19 pandemic. Calaveras County Public Health reached out to the county superintendent and immediately embedded an education representative into the county's Emergency Operations Center in March 2020 when the event started. They have continued to include education in all activities and weekly calls to this day. The Calaveras County Public Health collaboration and communication enabled the educators of Calaveras County to focus on students and freed our administrators to focus on providing a positive programmatic adjustment that allowed students to continue learning and achieving in a very difficult time." So, and the letter goes on. I don't want to read it in its full entirety, but I just wanted to take a very brief moment to acknowledge the work that has been done over the past very difficult year of this pandemic with regards to the partnership between CCOE and Calaveras County Public Health. We're very grateful for their partnership and the hard work that they're doing as school administrators, trying to keep our schools open and our kids safe and our teachers safe. And we're proud to be a part of that. And just want to acknowledge the team at Public Health for doing everything they can to keep those processes going and keep our kids in school and our kids healthy. Thank you.
Thank you, Mr. Leach. Are there any other staff announcements?
Yes, good morning, Chair Stopper and respective board members. Lisa Medina, Environmental Management Agency. Sam, congrats on your public health team. That is just incredibly awesome. And kudos to everybody on your team. I have two announcements today. The first being that, as a reminder, our Animal Services Department is having another free microchipping event this Friday the 12th and Saturday the 13th from 10 to 4, combined with an adoption event. We have still several cats that need forever homes. Just last week, we were able to adopt out 7 dogs, including 4 puppies that we rescued. All adoptions are $14 each, and for each animal. Please come and see us. We will even have treats for the humans. Our second announcement comes on behalf of our new Agriculture Commissioner, Jessica Fowler. Our Department of Agriculture started their annual roadside weed control program yesterday. They sprayed the rights of ways along each side of our county roads, beginning in the lower elevations and moving to the higher ones. Depending on weather events and weed resurgence, they may revisit and respray a roadside 2 or 3 times between February and July, which is their spray program's time frame. The Department of Agriculture sprays on behalf of Public Works in order to reduce fuel load fire hazards while increasing driver's roadside accessibility and driver visibility. If you are caught behind the spray truck on a narrow road, please be patient. The spray truck moves slowly and cautiously so as to make a safe application. Thank you. We just wanted to make sure our community was aware of our programs. Thank you very much.
Thank you, Ms. Medina. Mr. DeBasilio, I see you have your mic on.
I do. Thank you, Chair Stopper, and good morning, Board. I have a couple announcements. I just wanted to give you folks some stats. I have my marine safety crew give me some stats from last year's boating and waterways. They were quite busy this past year. We had a total of 22 accidents. 13 of those were serious to where people had to be life flighted out. Maloney's, we had 3 serious. Hogan had 6 serious. And Comanche had 4 serious. It just kind of goes to show that we have patrols on Tulloch pretty much all the time. So we had one accident with no serious accidents. So that shows that having patrols on the lake are very effective. Comanche had 5 total accidents, 4 being serious. One of those was we worked with Amador County because it actually occurred more on the Amador side. Hogan was our big issue last year. We had 12 accidents. 6 of those were serious. So we need to see about getting more boat patrol onto Hogan. I know the Rangers do patrol out there, but having the sheriff's boat out there would absolutely help. And Maloney's, we had 4 accidents with 3 of those being serious. And again, we have boats on Maloney's, not all the time because we only have 2 boats available right now. And I'll be talking with you during budgets about potentially trying to put another one together. So overall, the boats were busy last year. They had over 421 hours on the water, multiple citations, which included everything from not wearing life jackets to BUIs, which is boating under the influence. And there's a lot of activity from our deputies in trying to educate the folks on the new boating and waterway laws of having to have we'll call it a license. They have to have a certificate now. They have to go online through California's Boating and Waterways, and they can get a license showing that they've taken the boater safety class. Very important that folks start doing that, especially with the upcoming summer, not too far around the corner. My second announcement is I want to give a shout out to the volunteers in Calaveras County Sheriff's Office. We had COVID going on this year, and even during the COVID, they did over almost 2,400 hours worth of patrol in the county. They put on over 36,000 miles on our patrol vehicles and over 26,000 miles on their own personal vehicles. They did just over 1,700 vacation house checks, and our substations were open for 331 days. Considering the COVID thing that was going on, and most of our volunteers are retired, and I don't want to say elderly because I'm in that category. They put in a lot of time. I had 5 of our volunteers that put in over 300 hours this year, 7 that put in over 200 hours, and 8 of them that put over 100 hours. We have just over 30 volunteers now. And I want to give a special shout out to Sandra Kraft, who put in 992 hours of her own time, and then Betty Miner, who put in 658 hours. I think that when folks see our volunteers out there, that they absolutely need to give them a shout out and say thank you for the work that they do for our community. This is all volunteer time. They don't get paid to do this. They're here for our community. And I want to publicly say thank you very much to our volunteers. They do a fantastic job. We didn't have a lot of events this year just because of the COVID, but they're always out at the events, and the events that they were able to go to, they did go to. So again, I want to say thank you to our volunteers very much. Thank you for your time. Any questions?
No, I also want to say thank you to the sheriff's volunteers. I see them out consistently in different areas, especially like with the food banks and everything else, facilitating safe traffic flow and 900 hours, that's pretty much 20 hours a week. Is it 2,080 work hours in a year?
It is.
Something I want to just say out loud that you touched on, the boating safety cert. So that's a new law. So you have to take a boating safety course, and then you get a certificate. Is it sort of like a boating license?
You could call it a boating license. It is a certificate. that California is now requiring, and every year it moves up in age. I think now, this year, if you're 35 and under, you have to have that license. Basically, by 2024, everybody who operates any boating vessel, a powered boating vessel, will have to have this license. So they've been doing it in stages. It started actually, I think, 3 years ago. And again, they keep incorporating upper ages as they go along. It started out with people 18 and under, and it's been moving on up. And like I said, this year, if you're 35 and under, you have to have this boating certificate from the state of California. And you can do it online. It does take 3 to 4 hours to do, but you need to have it. If you don't, there is a citation. They had for a while a grace period, but that grace period is now gone. So there will be fines associated to it if you do not have the boating certificate. So highly recommended that you get it.
Thank you, sir. And one last thing, maybe in the future we need to bring up the Hogan Boat Patrol. That lake's in my district. It's a smaller lake, and there's quite a few people that end up on it often. I mean, it's not as small as Tulloch, but I'll touch bases with you at a later point on that, Mr. DeBasile.
Absolutely. Thank you, Supervisor.
Any other questions? Okay. Any other staff announcements?
No other staff announcements.
Thank you. So with that, we're going to move on to our informational updates, starting with number 2, Public Health Services. Receive an update presentation from staff on COVID-19, novel coronavirus.
Good morning, members of the board and public. Thank you for affording me the opportunity to present, as well as the honor of leading the Health and Human Services Department during this unique time in human history. I'm 49 days into this interim assignment, and progress is being made in the fight against COVID. We continue to take a balanced approach to educating and supporting our community. Here's the data for this week. At this point, we've completed 21,784 tests. We've had 1,811 positive COVID cases. We have 86 active cases. We've had 1,702 people recover, 4 active hospitalizations, and 23 fatalities. Last week, we received 800 doses to public health of vaccines. I know that's something people are interested in, and I will discuss vaccines in more detail more toward the end of my presentation this morning. But I do want to say that as of January 26th, 2 weeks ago, when I last presented in front of the board, 2,080 vaccine doses had been administered at that time. 2 weeks later, that number is now 4,646. So we've more than doubled over the past 2 weeks. That shows you that we're gaining momentum, we're receiving more consistent allocations. It's not as consistent as we'd like to see, but we have been receiving doses, and frankly, our partnership with Mark Twain has been fantastic, and they've been putting shots into arms most days, Monday through Friday, from what I understand, and they'll talk about that in a few moments coming up. We're still working on tiers, we're still working on Phase 1A, Phase 1B, Tier 1. A lot of the folks that we were working on the last time, so that includes, right now, really, to boil it down, our main efforts continue to be with that 65 and over population. We're also working second doses to folks from Phase 1A and the early parts of Phase 1B. So that's kind of what public health is up to this week. We are working to onboard with the state's My Turn system. So if you've heard about that in the public, where you're able to go on the state website and input your information into the My Turn system, We're able to do that now. However, we are still working with the state to be onboarded onto that. So we don't know exactly when that process will be finalized because as with all software implementations and state processes, there are always things to work through to make sure that it is ready for us to say, yes, you can go on there and register. That will be for our clinics. Mark Twain will have their own processes, and I'll let them speak to that. All right. Right now, vaccine allocation, because that's always a big question. Vaccine allocation, when it started back in December, vaccines were being sent to local public health departments, such as our public health department, and then we would pass them along to the clinics. Then in January, we started to see the clinics start to receive their own allocations through their multiple county entities. Otherwise, you'll hear MCEs. So then they were getting direct allocations, we were getting some, and then CVS and Walgreens and the pharmacies were getting their direct allocations from the federal government. What's happened is now with the third-party administrator coming in, with Blue Shield taking over vaccine allocation, there's still a lot of state confusion that frankly we don't have answers for, so it's hard to communicate to the public. But I want you to be aware that we are monitoring those processes and advocating to make sure that enough doses come into Calaveras County to go into arms. You know, whether Mark Twain is giving, if you're a member of Calaveras County, whether Mark Twain is giving you a dose, or your local public health department is giving you a dose, or you end up at a clinic, or when CVS is ready to start getting doses to the general public. I don't know when that's going to be. Ultimately, what you want is you want to get a dose. So we're working as much as we can through the confusion to make sure that all of us are partnering to be in the correct phases, the correct tiers, at the right times, to make sure we go through this systematically. Obviously, a lot of changes at the state level for how they implement has made this very confusing for a lot of you, as well as for us. And I feel that over time, we have begun to narrow in some of that confusion and streamline things and have very efficient clinics like what you're seeing at Mark Twain, where they're doing several hundred people a day putting shots into arms. So we're happy with the progress that's being made, but we also acknowledge a lot of remaining confusion, and we will continue to clarify and try to bring as much transparency to you as we possibly can. CVS does have appointments actually beginning today. Today through Sunday, my understanding is they are vaccinating the long-term care facilities, at least giving the first doses to those facilities. Supply. So last week, as I said, we received 800 doses. We have shared some of those doses to Mark Twain because of the efficiency of their clinics, but we're also really focused on second doses, child care providers, getting our teachers vaccinated. So those are some of the things that public health is doing this week. We'd like to see supply increase to the point to where we can get to, frankly, what you see in some of the larger jurisdictions, urban areas. I don't think we're going to build a football stadium, but we are making plans for if the supply increases to the point where we can justify having larger scale drive-through clinics. We would love to bring those to the community and vaccinate as many people as quickly as we can. Right now, the supply is still not at that level, so we've been building the contingency plans as we go in preparation for that, while really staying focused on the immediate targets of that 65 and over population and the other folks in phases 1A, phase 1B, tier 1. Let's see. Today we have the honor of having Dr. Beatty, who's our interim county health officer, available, as well as Dr. Atwell, the chief medical officer from Mark Twain Medical Center. And not to diminish the value of our esteemed colleague, Mr. Doug Archer, over at Mark Twain. So we have these gentlemen available to, frankly, answer medical questions that a lot of times I have to remind people, hey, I'm not a doctor. Doug likes to give that disclaimer, but we do happen to have a couple of doctors with us today, so if the board does have specific medical questions about the vaccines, things you've heard about vaccines that are coming in the future, and maybe what some of those transitions would look like, questions about second doses, what to expect, happy to have our medical colleagues with us on this call today. A couple of last notes on my end before I start to pass. Actually, I probably still need a couple of minutes. We remain in the purple tier with regard to the blueprint for a safer economy, right? So the California tier system, we remain in the purple tier that we've been on since January 25th when they removed the regional stay-at-home order. I believe that's being updated today. I do not believe that we would be dropped into a less restrictive tier at this time. Our numbers are all trending in the right direction, but if you remember, we had a long way to go. So I believe that, we're still probably a few weeks out. Fingers crossed. We'd like to see the numbers trending in the right direction. We need our case counts to come down, which means, frankly, we need less people being exposed to COVID. We need people to take their precautions. We need to make sure you're wearing masks, that you're keeping your distance, that you're avoiding social gatherings, washing your hands, and all the things that we know that help us get our case counts down. The other thing we need is we need our positive test rate, our percentage, to come down. Those are the two things we need to be able to open our businesses even further. And for the testing, I want to remind people that we have testing. Pull up my note here, make sure I don't misquote this. So we have testing at Ironstone and Murphy's on Tuesdays. So today that's going on from 7 to 7. And then tomorrow we have testing at Calaveras Consolidated Fire on Jenny Lind Road out in Valley Springs. And that is from 9:30 to 1:30, 9:30 a.m. to 1:30 p.m. And I would encourage folks to go get tested. Maybe you want the peace of mind. Maybe, frankly, you just haven't been tested in a while. This is not the one, sorry, I'm going to beat up the medical wording here, but this is not the one that gets jammed way up the nose. This is the one that you circle around, right? It's a self-test. I encourage folks to go out and get tested. Frankly, even if you're healthy, we know that roughly, Dr. Atwell, you can correct me on this, Dr. Beatty, roughly 25% of people out there are asymptomatic and can still potentially spread. So, that's a ballpark figure. That's my layman's understanding of it. But it's important that non-symptomatic people get tested for a couple of reasons. And one is that we want that rate to come down, to be quite frank, so we can support our businesses. Two is from a public health standpoint, we need to slow and stop the spread. And if you're asymptomatic, but you end up testing positive, it's important to know that you could be spreading something. Maybe you felt fine, but you could be spreading that to somebody that you care about who, frankly, is now not going to be asymptomatic and is going to be sick. And that's how this thing, frankly, caught fire. So just a few notes for you on that. I forgot to mention that we've conducted public health. Just the public health department has done 553 tests since December 23rd. And I think I forgot to mention that there is still the state testing OptumServe site up in Sonora, if anybody's wondering. All right. A lot of stuff to cover. So just checking my notes before I pass it up. Prevention is still the best defense. I covered that. Wear your masks, folks. And frankly, even after getting vaccinated, we want to make sure that message gets communicated. People are starting to receive vaccines now. The guidance remains. And keep in mind, you get that first dose, you haven't built up the 95% immunity you hear about yet. You really need to get the second dose a couple weeks after that. And even still, for now, the guidance is you need to be wearing your masks. Okay, we don't know enough about things yet to expect that because you've been vaccinated, you're not passing it along. Okay, you've still got the majority of the population, the overwhelming majority of the population has not received a vaccine yet. And we need to be respectful of that, and we need to be patient, and continue to take the safety precautions that we know we need to take. So with that, I am going to turn it over to my esteemed colleague, Mr. Doug Archer, for an update from the Mark Twain Medical Center. Thank you, Doug.
All right. Thank you, Sam. I'm actually going to let Dr. Outlaw provide the normal stats and things that I provide, just so you can hear from him. One thing I wanted to share is just the partnership. Sam mentioned, I think we're actually pretty fortunate to be in this county and have the partnership we have. It's very much all across the board throughout the nation how quickly people are vaccinated. But I think for Calaveras County, for our resources, I think we're doing a really, really good job of getting vaccine into arms, as Sam mentioned. So, So I'm fortunate to have that partnership with the county. It's just nice to have friends. And we have a good group of friends making sure. I mean, for instance, our staff at the hospital helped schedule some patients for the county clinic this week. We're working on allocations together. And as the world keeps changing with Blue Shield and Kaiser getting involved, I think it's just all the more reason, all the more benefit we're gaining from this partnership. So thank you to the county, and I'll hand it off to you, Dr. Outlaw.
Thanks, Doug, and thanks, Sam, for the intro. Completely echo what Doug's just said right now with the partnership with the county. It's really nice to see the hospital and the county working so well together to take care of the community. So I feel really good that I'm a provider in this county and that we're actually getting this vaccine out as quick as we can. So just to share some statistics with everyone, currently we have 11 inpatients, 9 in med-surg and 2 in ICU. We have 5 COVID positive inpatients. 4 of those are in med-surg and 1 of those are in the ICU. So our ICU capacity is really good right now. The numbers have been trending down, at least in our inpatient census, which is really good. For the numbers, in terms of the vaccinations, we've given 1,760 doses thus far. We have 700 scheduled for sure this week, and if we get an allocation, we'll be giving an additional, hopefully 350 on Friday. So, right now it's really just getting more vaccinations and getting more vaccines, and if we can get that through the county, through Dignity, we can get that out to the community as quick as possible. And Doug, if there's any number that I left out that you normally share, definitely feel free to jump in.
Sure. Thanks, Dr. Atwell. I had mentioned previously, so we are trying to plan a vaccine clinic up in our Arnold clinic in the Big Trees Market shopping center. That's very much dependent on the allocation that we hope to get towards the end of this week. So I don't have a confirmation yet. Some of this is, I don't want to give the wrong impression, but some of it is due to the changes with Blue Shield. They just really released their plans yesterday. We have an information request today that we need to fill out, send back to them. I think we'll be able to shore up our allocation from Dignity sometime later today or tomorrow. But our goal would be to host a clinic up in Arnold next week, and then continue more vaccinations next week. Next week is actually the beginning of our second doses from our first community clinic. So next week we have those second doses on hand already. So even without another shipment, we'll give 860 second doses next week. And after the efforts this week, that will bring our grand total up to, doing math really quickly, about 3,300 doses provided, including second doses for the community. So, and a quick update on the kind of the process. I'm sure many of you have heard, concerns and frustrations from our community members. Our process has not changed, although the some of the rumors and perceptions of the process has definitely been interesting. So we still have our wait list. If a patient or a community member is not sure if they're on the wait list, they can call and leave another message and make sure they're on it. you will get what I've referred to as a robocall. You will get an automated call back within a few days, just confirming your place on the wait list. That wait list shifts a lot. We try to prioritize by age so that it's a fluid document. But that is still happening. We estimate we've got a little over 4,000 people on that wait list right now. It's growing every day. So that's a good thing. And we were trying to go live this week with our online scheduling platform, but they had a couple of testing issues that we discovered last week. So it'll probably be later this week before that goes live, and then we'll push that out through media. I also apologize. I haven't had an updated statement like I had the past couple of weeks, and mainly that's because the information's changing so quickly. I feel like we'll have a little more solid communication, hopefully tomorrow, so I can send that out. I didn't want to create even more confusion on top of the confusion that's already there. So, as always, for the supervisors, feel free to reach out to us if there's questions, concerns, and we'll field those as quickly as we can. I think that's all we have from the hospital.
Thank you, Mr. Orcher.
Thank you both. And I don't want to leave out Dr. Beatty. Dr. Beatty, I know you wanted to take a couple of minutes and speak to vaccines a little bit. So please feel free to chime in here.
Thank you very much, Sam. A couple of months ago, I was asked to step up as the interim public health officer. I did so on the condition that I could focus my attention on ending the COVID pandemic. The strongest tool in our kit is going to be the vaccines. Currently, we're using Moderna and Pfizer, and those are good. In particular, the Moderna has an increasingly strong supply chain that's helping us out. The future will bring us the AstraZeneca vaccine, which should be available in stronger numbers. And then perhaps most exciting of all is the Johnson & Johnson vaccine. On February 26th, they're going to seek emergency use authorization for that vaccine. It has some stellar qualities. It is inexpensive, it is effective, and Johnson & Johnson suggested that they might be able to make 1 billion doses. That would put us into a very good spot where we could open up clinics in Arnold and Copperopolis and Valley Springs and the whole county. We could go much better. I await that. I really look forward to doing more vaccinations because that's what's going to take us to the president's goal of 100 million shots in 100 days, and that's certainly where we want to get. In the end game of all this, at the end of summer and fall, I hope we come to a point where we're tracking down the last cases and ending this COVID pandemic forever. That's a hopeful kind of thing. It'll take a great deal of work and concentration. I hope we're up to the task. I look for your support. Thank you very much for your time.
Thank you, Dr. Beatty. Was there anything else, Mr. Leach? Okay, I'll go ahead and go with any board questions. Mr. Toffanelli?
Yes, my question is to the doctors. It's my understanding that on the first round of vaccinations and possibly the second round, the first round you're supposed to obtain 66% immunity, but that's not immediately. Apparently it takes at least 2 weeks to build up to that point of 66% and obtain the full status of that vaccination. Is that correct?
So it's variable. It depends. There's so many different factors, and we don't really know for sure because the trials really looked at the efficacy after 2 doses. So it is true you don't get immunity right after the first dose, and after a week or 2, the body has had an opportunity to build some antibodies. I mean, you do have some immunity. That number is, I've seen stuff quoted anywhere from 50% to 90%, but it's so unique to each individual person, it's really hard to measure. The trial's really focused on the second dose, and it is variable, but about 7 to 10 days after the second dose that you get your maximal immunity. I think Moderna might be slightly longer than that. So you don't get it right away. It does take time, and really does achieve that maximal 95%. It takes or two after your second dose to get that.
And that's my point. If people think they went and got vaccinated, the next day they're not, okay, I'm good. It takes a while
Exactly.
to build. And that's the same with a flu vaccination is the same thing. Immediately you're not immune to the flu. It takes time for your body to build up those antibodies. So you can't just say, okay, I'm done and walk away. I think it's very important people understand that it takes your body time to build immunity for it.
That's exactly right. Good point.
Any other board questions? Ms. Calloway?
Mr. Leach, I have several on the positivity rate. I'm bringing it down. You mentioned that we had 21,000 who've been tested. We have a population of 45,000, so that means we need 24,000 more. I'm really not clear on what it's going to take to bring it down. Another question: if the at-home tests, COVID tests are done, does that help or does that connect some way with our positivity rate? And third, if you've had your vaccinations, let's say both of them, should you still get tested so you can be a good resident of the county and help us reduce our positivity rate?
Okay, well, the first question with the positivity rate, those tiers are available on the state site, right, and the percentages. So right now, the two metrics, again, the case rate or the positivity percentage rate has to come below 8%. We're getting closer on the case positivity rate than we are on the adjusted case rate, so the number of cases. The number of cases, we're still a little ways off. We're still having a fair percentage of our folks who are getting COVID, to be quite frank. It's coming down significantly, but we still have quite a ways to go. On the testing positivity rate, we need it to come below 8%. So if 100 people get tested, we need less than 8% of them to come back positive. So that's why I'm encouraging, let's get the people who feel healthy, maybe asymptomatic, out there testing. Because if the only people who show up for testing are the people who are sick and, frankly, people who are likely to be carrying COVID, then obviously that rate is going to struggle to come below 8%. So, frankly, in a way, you're supporting our businesses if you're asymptomatic, hopefully, asymptomatic, and you show up to testing and get tested. Hopefully that helps. The home tests, no, are not factoring into that. And anybody, okay, your home self-test right now is not part of that count. The last question is kind of teetering more on a medical question there. So about the vaccination, should people who've been vaccinated still be showing up and getting tested? My answer would be yes, but I'd like to hear from the medical doctors. And
yeah, absolutely. We just don't know enough yet in terms of if you can be a carrier, if you can kind of have subclinical COVID even after vaccination. So you should definitely get tested. There's a lot of the news about variants and, mutations that are prevalent in COVID from other countries. So testing and vaccinations are our best tools right now to fight this. And so definitely would encourage everyone to continue to get regular testing, symptoms and no symptoms, because we just don't know yet if you can still be an asymptomatic carrier after being vaccinated.
I would agree. There are some preliminary studies that suggest that vaccination may prevent spreading the disease, but those studies are still preliminary. We need more data before we can make that assertion with any confidence. I think right now combining testing and vaccination is a good plan.
Yeah, and 95% is not 100. So, it's important that people know that the vaccines work, that 95% in clinical trials, 95% immunity is a really important number. It's incredible that it was developed as quickly as it was. But that doesn't mean that you're superhuman and you're 100% immune to this thing and can't be a carrier. So I think you've heard that consistently from all of us. I'm not trying to play medical doctor here, but it stands to reason. And so, yes, the simple answer, Supervisor Callaway, is it sounds like there is pretty clear consensus that people should continue to get tested and continue to take precautions with the masks and washing hands and avoiding large gatherings, even after they've been vaccinated, at least for a significant amount of time moving forward until any kind of guidance on that changes.
Just one more on that before I go to my next question. If I get tested 4 times, is that considered 4 new tests or 1 test? I'm part of the 21,000 because I've already been tested 4 times.
Yeah, that's tests conducted.
Got it. Okay. I'm going to move on to the next one. You or Mr. Archer, you've mentioned, and it is true, people don't know what to call, what number to call. When we become part of My Turn, do people call My Turn or do they call Mark Twain Medical Center to get on a list?
So Mark Twain has their own processes, and right now Mark Twain is providing this service to the 65 and over population. That is their target. That is a huge number of people, and it will take months to get through that 65 and over population. Right? We'd like it to be faster than that. Who knows? Maybe the supply will increase and it won't take several months. But right now, that's where the focus is. So if you're in the 65 and over population, you're trying to get on the wait list through Mark Twain. Mark Twain will have their own registration system. The folks that public health is working with will be going through the My Turn system. So right now, public health continues to work with targeted groups that we're reaching out to. And that is how it will be until there is a future announcement. At this point, I don't want to confuse people any further. So when My Turn becomes available, and I will, fingers crossed that hopefully next week I can make an announcement on that because I'm back, today's the 9th, so I'd be back on the 16th and back on the 23rd. So I would anticipate that I will have more clarity next week and hopefully be humming along by the week after that. That all, of course, depends on our partnership with the state and getting onboarded. You know that normal IT processes, and you throw in the state, and this could be a 6 to 12 month implementation process in normal times. We recognize these are not normal times. We understand that there will probably be some kind of headaches, but we are working Monday through Sunday, trying to eliminate those headaches, working with the state, get the My Turn system ready for Calaveras, and just wanted to let people know at this point, yes, we're moving forward with the My Turn system. No, it is not available to you as of today. I will continue to update as we move forward over the next 2 weeks, and I'm back both Tuesdays. All right?
And how does CVS fit into that? Now, here we have this is take 65 and older. Gee, do I call Mark Twain? Do I call my Turn? Do I call CVS? And if it's confusing for you, it's double down for the community.
Absolutely. Okay, right now, today, Mark Twain. If you're 65 and over, Mark Twain is your answer today. All right? We will update that if and when that changes. We are awaiting a lot of clarification, frankly, from the state, the feds, and CVS ourselves. So I can't give you answers that I don't have myself yet. We are very interested in that issue and look forward to the updates on what CVS's role is moving forward. Obviously, we see the things in the national media, and it's really confusing when they start talking about, CVS doing vaccinations now in California. That doesn't mean that our local locations at Valley Springs and Angels Camp are ready for that. They have not been announced as open sites for vaccinations yet. So to be clear, with our 65 and over population, Mark Twain is where you're registering as of today, and we will update as we move forward. Doug, is there anything you'd like to add to that?
Yeah, so we, at this time, we are not planning on converting over to My Turn. We'll see how it goes, but we have that electronic health record and kind of a platform to manage this without My Turn. So we plan to, instead of changing things up, we're just going to stick with our process. So the number remains the same, call Mark Twain. If there's an announcement about CVS, and I can vouch for the folks I've talked to that, honestly, I've talked to some individuals that have called us 200 or 300 times themselves. I would encourage, once other avenues open up, pursue them. The important thing is that you get the vaccine. Honestly, it doesn't, if you have the option of getting it through CVS, go for it. But for right now, the only, confirmed source for 65 and over in Calaveras is Mark Twain.
Okay, Mr. Archer, I'm not letting you off the hook.
All right.
Everyone that I've talked to who's been to Mark Twain for their jab have been very pleased with the process and how they've been treated. So, at least on behalf of the community, we thank you for that. My question is Mark Twain receives an allocation from Dignity, and sometimes public health gives you part of the public health allocation. When Blue Shield starts allocating, will that be an allocation to you from Blue Shield, from Dignity, or Blue Shield to Dignity to you? How will that work?
I honestly don't know yet. Some of that's being worked out today. My guess is from the data requests we have that we need to send out today, it'll be Blue Shield to Dignity Health to Mark Twain. That's my guess. And that's the way it's kind of shaping up. But I'll be able to update you a little bit better towards the week.
Okay. Thank you, Mr. Archer. Thank you,
Thank
Mr.
you.
Chair.
And Supervisor Callaway, that's sort of my understanding too, although of course we are awaiting clarity on that. For us, we are supposed to eventually be receiving our allocation through the third-party administrator as well. And that also connects to the issue with the My Turn system, because as local health departments, we're actually being told that we will be required to be on the My Turn system, whereas the MCEs, such as Dignity Health and then Mark Twain, they have their record systems that frankly connect to the state data. So the My Turn system is to make sure that all the vaccine doses get accounted for and tracked properly at the state level. That is something that I haven't explained perfectly to the public. When we were originally tracking vaccine doses, we were tracking them locally to say this is how many doses we've put into arms here. So if you're a deputy sheriff who lives in the valley and drives up here, you may have received your dose here from us. So that's what we initially had to track for the first, roughly month and a half. What's happened now is the state has been tracking the data, but the state tracks the data by where you live. So the state doesn't really care if you got your vaccine shot somewhere else. They care about where you live. So as of yesterday, the numbers that you see on our data dashboard are consistent with what the state numbers are, because that's how many vaccine doses have gone into arms of Calaveras residents, right? Which if you're living here, that's what you want to know. You want to know how close are we getting to having our community vaccinated to the level where we may achieve herd immunity, right? And we've talked in the past about filling up that football stadium, right? 60,000 doses. I'd love to have the doctors correct me on that, by the way. Maybe you have a better number. But 60,000 is really just looking at trying to get to roughly 2/3 of our population, cutting out people that are 16 and over, or 16 and under, who haven't been approved for use yet. We know that some folks are going to just refuse to get the vaccine, but I'm trying to give you a ballpark number, literally and figuratively. So, right now as we approach 5,000 and getting into next week, and hopefully we'll hit 6,000, get close to 10% of the way there, we're making progress. It feels good to see us go from, frankly, 2,000 to 4,600 in just 2 weeks, more than doubled in 2 weeks, and we wouldn't be doing that easily without our partnership at Mark Twain. So really appreciate you guys being on here again. Can't say enough about the work you're doing and the quality of those clinics and the great things we hear from people who've got it. Obviously, that's not taking away the frustrations of people who are sitting on a waiting list and want it now. We understand all that, but you talk to people on their way out the door after getting vaccinated, and frankly, more than anecdotally, we've heard overwhelmingly positive things, as Supervisor Callaway referred to. Are there more questions for us?
Are you done, Maria?
Are you done, Ms. Callaway? Thank you. Mr. Garamendi, and then I'll move on to Ms. Fullendorf.
Thank you, Mr. Chair, and thank you, everybody, for coming on board to do this presentation. 2 weeks is a lot of time in this world. It's been a while since we've updated. My first question was, I was very concerned about the fact that Mark Twain's not using my turn, but I was happy to hear. Thank you for explaining that to me, Sam, that we're at least amalgamating the numbers through the states when we get the state dashboard. I continue to have concerns about, not having a single system, but it's probably not a battle I'm going to be able to solve right now. I worry about, we're throwing out, Mark Twain's taking responsibility for almost 20% of our county's population, which we're grateful for. I just want to make sure that everybody's moving as efficiently as possible. But my question is, last time we met 2 weeks ago, we had given pretty clear direction that we wanted to make sure that everybody was working on the same page. And I'm really happy to see Mark Twain working on the same page with public health and HHS and getting these things together. We talked about trying to use force multipliers to help people out, to relieve some of the stress and pressure, and getting OES involved. And I wanted to ask and follow up, how is that going? And do we have Mark Twain, public health, OES, all in the same room, all working from the same page? And if you could give me an update on how that's going and what it looks like.
Yeah, thank you, Supervisor Garamendi. We have had some initial meetings with OES, but we were clearly slowed down by the storm. So we met on January 26th at the last board meeting, 27th, had a follow-up meeting, and then we were hit by the storm, which frankly pulled our OES team away a little bit, as well as us at HHS with the warming centers. And hate to blame it all on a storm, but then I had a pretty busy end of the week. So we are scheduled to meet with the management team and OES tomorrow morning at 10 a.m. We have some preliminary discussions about planning for larger scale clinics in the future. We have the commitment from Mark Twain to partner with us on that, although we haven't sat and hammered out details. We're not at that point yet. But we are working on that, as well as trying to tighten up communication strategies, understanding that we have the call center over there, and that we need to have OES more plugged in than we have. So we're working through all of those things and have a meeting set tomorrow. So yeah, I'm encouraged that we're ready to scale up now, and we'll hope that the vaccine doses follow. So that's obviously the big part. Is the supply really going to come through to us to the extent where we can do larger scale clinics? But even if not, as we move more towards setting up even smaller scale travel clinics, we want to make sure that we have teams of medical professionals and security and everything we need to head to the outlying areas, frankly. So for your district, Supervisor Garamendi, for example, if we were heading up to West Point, which we hope to do in the near future, or if, like Mark Twain's plans to head up to Arnold, we'd like to get down to Copper. We'd like to take the vaccines to where people are, and especially for folks who are 75 and over, we want to target some of those folks with future clinics that should be coming up soon.
Right.
So even if the supply doesn't, exponentially increase, as long as we have a steady supply coming to our local health departments and specifically Calaveras County Public Health, we want to make sure that we have the partnership with OES, continue the partnership with Mark Twain, and frankly, our other medical providers in our community, and that we're eventually in routine conversations with CVS and what their role is too. That part has not been established, but yeah, we look forward to all of that.
Thank you very much. One of the things that I want to, just make sure that it's in front of everybody that, we started off with this great compliment from the CCOE for how we've worked with them in public health and Health and Human Services. I just want to make sure that, at the beginning of this, when we had the EOC stood up, everybody was in the room. And I don't want it to be a courtesy to bring everybody in the room and inform them. Everybody needs to be on the team. And we've got a ways to go, and it'll help spread the load so we don't deal with so much fatigue, and allow us to sustain this operation for what we're going to need another 6. Dr. Beatty suggested maybe we could get to this, start seeing the light at the end of the tunnel, but that's still a very long way away. We need to pace ourselves, and I will ask at every meeting how we're doing, and the next one I will ask exactly what that looks like operationally, because I think we've been pretty clear as a board.
Yeah, it sounds good. And timing is everything, as
right,
you know.
I understand.
So,
and I'm not putting you on the spot today.
I love being on the spot. You know this, but I do think that the timing, choosing my words here wisely, I think that we're really in a point where our role in this community is kind of, I'm going to make the comparison to being in the surge mid-January, where things were just really, really hectic for a little while there with the testing and trying to get caught up on contact tracing and this. I think we were running really, really hard, and the vaccine confusion that came down from the feds and the state just made it to where we were just running 24/7. I mean, literally sometimes. I can tell you at the board meeting on the 26th, I probably hadn't slept in close to 24, 28 hours. I mean, the flow of information was just ridiculous. And at the point we're at now, things frankly are becoming more systematic, but they're also scaling up at the same time. So they're becoming more clear. It might not feel like it at all times, but they're definitely, compared to mid-January, the picture is getting clearer and the volume is increasing. And those are both good things. And they're both things that, frankly, we need OES's support on, and we need Mark Twain's support on. We need to make sure that we're partnering with CVS, all the other providers, and utilizing the folks in the community who, frankly, have been wonderful volunteers. Sheriff DiBasilio talked about his volunteers this morning. Can't think the support that we've gotten locally from volunteers. It's just so many levels. It's really beautiful to see the community trying to come together, even when at times we're frustrated with each other and just frankly scared or anxious or overwhelmed at times. It does feel like things are taking a turn. Like we've hit that plateau, starting to see some movement toward the end of the tunnel. It's going to be a long, steady process, but I do think we're all in it together. And I think we all want that.
Let's just
thank you.
Let's make sure we don't have another 28-hour day, Sam. That's definitely tough, makes it seem tough, but we're probably not getting the best thinking after 27 hours. So spreading the load would be good, because no one should have to do that again. So thank you very much.
I agree.
I've had a few of those. Ms. Fullendorf.
Hi, Sam. I am not quite sure if this is a question for you or Metro Archer, but it does have to do with Blue Shield. I was on a call last week with the RCRC, and it seemed like the contract with Blue Shield was to deal with the onslaught of vaccines and manpower in more urban areas. So how did that apply to smaller counties such as us and our neighboring county when we're not even getting the allocations? Therefore, we really don't have the need of the manpower that is the state is contracting with Blue Shield. So how is that going to affect us, and do we need that at this time, and how do we have options? And then with that, how do we meet the state 100% vaccine when most of our area are not getting those allocations in a timely manner, and when we have the highest population of 65 and older? It seems like it's some of these things coming down from the state are great for San Francisco, but they're not appropriate for the rural areas in California. And I know you guys could always use help, but is that something that we really need to be putting our energy into when we don't even have the allocations? And if the state wants to do that, how do we advocate for more allocations to have that third party come in and do that?
Yeah, unfortunately, we do not have an option. The third-party administrator was a state decision that, frankly, well, I'll speak for myself, that I adamantly disagreed with. We, as you know, we've written the letters and gone through the state channels to disapprove of that decision, but as things happen from the state level, that was a pretty unilateral decision that was made, and we were told that that's how it's going to be. So we do not have an option to opt out, even though we wish we did. So frankly, we hear a lot of different things from the state on the third-party administrator's role. We have almost nothing in writing that would be helpful, and what I have learned in building this plane while flying is that if the state doesn't put it in writing, I'm not going to jump at it. And I'm not going to continue to spread their rumors. Okay, we're told something different very frequently about Blue Shield's role. And frankly, about what our allocations will look like, whether they will go up or down, what types of people we will be vaccinating, how the tier schedules could change. All of that stuff is kind of circling rumors, to be quite frank, and just things that the state says, but we'll wait on written clarification. And instead of getting caught up in that, what we will do is continue to put shots into arms for the people that we have scheduled here. So we're not going to get pulled off course every time the state starts to talk about maybe we're going to go in this direction, maybe we're going to go in that direction. It's really frustrating, because right now what we need to do is have the folks who are 65 and over getting shots in their arms. We need to continue to finish phase 1A and all those medical folks' second dose. We need to make sure that education and childcare are getting their first and second doses. We need to make sure that emergency services and emergency response folks are getting those. And then, frankly, after that, we have the food and agriculture folks to worry about, and we still can't get answers from the state as to what qualifies in the food and agriculture category. So, we appreciate RCRC's support and interest in this matter, and I would encourage you, as part of that, to continue to advocate for small rural counties like ourselves, because as usual, we tend to be an afterthought in a lot of the state political processes, and we want to make sure that we are taking care of the aged population and our large population of 65 and over, which frankly is a higher percentage here than it is in most counties, and especially in the urban areas. So we acknowledge that that's a priority, and we'd love the state to also acknowledge it in looking at rural communities and making sure they're taken care of. So I agree with you, and I wish I had more clarity for you, Supervisor Fulham. Did I answer all your questions?
I have one follow-up. You said earlier that, and you and Mr. Archer said earlier that you have a good relationship with other providers. How does it work when other providers, individuals or members of other providers outside of the county, outside of Mark Twain, get the vaccine? How does that communicate back to you guys? Is that go through the state system? For example, someone might be in the Sutter Health provider system and they're being sent down to Lodi to get their vaccine because they're in the 65 and older. How does that communicate back to you guys if they have called and in that time frame they've gone somewhere else to get their vaccine? Is there communication through that, or do you just depend on the roller call when you call back through that to find out that they've taken it? Is that how that works?
Yeah, so for Mark Twain at least, so, I mean, there's so many new developments happening, CVS, Blue Shield, all these different opportunities. We're not taking anybody off of our list unless we schedule them and give them a vaccine, or we call them and they say, I was just in Sacramento and, got it at UC Davis. So there is backfeeds, as Sam alluded or illustrated earlier. So when we document a vaccine administration in our electronic health record, it gets pushed out to the state level system so that they're aware that, John Smith got the vaccine. But the kind of the push to us to say, take John Smith off of every other list, that's not there. And frankly, I don't think I would rely on it even if it was, because I think we'd end up with people inadvertently coming off of lists. So we're keeping you on the list until we either give you the injection ourselves or you tell us that you've received it someplace else. And further, we are not, I'll call it, our vaccine clinic is agnostic. We don't care if you're a Sutter patient, a dentist patient, uninsured, whatever. All we care about is that you live in Calaveras County. So we're not, focusing on one population or the other. Just 65 and up. That's it.
Yeah, and it would be the same for us, probably on a smaller scale, but it would be the same for us. The state is tracking who got their shots, right? But that doesn't necessarily mean that we're going to get clear communication back to us. So we will work through our lists and make sure that we've contacted people. And if people have already received the vaccine elsewhere for some reason, it's really no hassle to just move to the next person on the list.
Thank you. That's all I have.
Thank you, Ms. Fullendorf. I'll go in order. I have my questions written down. I'll start with Mr. Archer. A few weeks ago when I was rushed into getting a surgery, they went in and did a COVID test. That would have been out of county at the time where I was at, so that wouldn't have impacted our total count. But is Mark Twain's tests that they do for patients coming in counted towards the total county count?
Yes.
Mr. Leach, maybe you can. Oh, it is. Okay. Excellent.
Well, and Supervisor Stopper, to be clear, your test is by your address.
Yep.
Okay, so if I got it outside of county, then it would have counted towards Calaveras?
Correct. And if somebody for some reason lived in Stanislaus and got tested here, the test counts are by the address they live at.
Okay, understood. And that's the way it's applied for positive testing also at that point.
Correct.
Now, Mr. Archer, a follow-up. You said I'm glad you brought up that the call back on people that are trying to get their vaccines. You have robocalls going now. Initially, you were overwhelmed, with a high number of calls. Understandably so. I think even the phone numbers broke down. And we addressed this significantly at the last meeting. To follow up, I think you've propped it up a little bit better. I'm still getting calls from constituents that haven't necessarily gotten a phone call back. Some of them have called 3 times. per what they're telling me. I understand the doses aren't there to necessarily give everyone, and I've explained this, and everyone that's heard this is receptive to the facts as they are. But the phone call back, letting them know that they're on the list, when it becomes available, they'll be called, I think is crucial. I think that will lower the level of a lot of anxiety out there about the process. And I know, and I can appreciate that maybe you aren't going over the My Turn system. I have issues with a lot of the state, their EDD system's broken down. We can go through a number of state systems. My Turn's a new system they're bringing online. We don't know how it works yet. There's going to be bugs to work out of it, So stick with what you're getting ironed out right now. If you get it to work properly, stick with it until we know My Turn works properly.
Yeah.
Is what my suggestion is. And thank you, Mr. Archer. I'm going to go on to Dr. Atwell and Dr. Beatty. I have a couple of questions for them. We discussed 3,300 doses that we put into people. I mean, honestly, not all of those are second doses, but at this point, that's 1,350 people if you divide that by half, because each person needs 2 shots. You also brought up that, just because you get the first shot, you aren't immune. That's very true. I know 2 people that have gotten COVID in between shots. One of them works at the hospital, and they were very public about it when they got it, and they got it bad. The thing is, the Johnson & Johnson you brought up, they're talking about, bringing it forward later this month. They're talking about 1 billion shots. The thing, I understand, can you tell me if this is correct? Is that a single shot instead of a double shot?
It is a single.
So that's going to be very beneficial with 1 billion, as opposed to, all the other ones being double shots, that they would have to do 2 billion to do the amount of that Johnson & Johnson is proposing, correct? So that would streamline the process. Thank you, Mr. Beatty. I appreciate that. Mr. Leach, couple more things. I just want to, reiterate what Mr. Garamendi brought up earlier. Let's get OES plugged in, as you said. Just be on the level, everyone on the same playing field. They don't need to have their hands on the controls for everything, but having all the information as we proceed forward and having them in the room would be a great step at building our partnerships across the board. Something that Ms. Fullendorf brought up that not everything the state puts forward is appropriate for rural areas. I know through my CSAC meetings, often it comes up, one size does not fit all. The state's decision, and Mr. Leach, I appreciate you standing up and saying, look, this doesn't necessarily look like it'll work for Calaveras County, but the state's giving you no option to opt in or opt out. It's the state says so, and you proceed. This has been an issue brought up by, more often than not, rural counties across the state, and even cities and more urban areas. I mean, it's not necessarily a one size does not fit all. One size does not fit anybody in certain situations. So, Mr. Leach, I'm not sure if the board has appetite for it, but there are multiple counties across the state that have spoken up, and they've adopted. It's not necessarily an option to opt out of what the state's saying, but it's just voicing that, look, not necessarily everything that's being put forward by the state's working for everyone, and they've adopted a healthy communities resolution. I would like to have that discussion with the board in the future about that, we don't have to necessarily go by the template other places have done, but, putting forward, that Calaveras does not necessarily fit the template the state's putting forward for the rest of the state always, while we're still receptive to what they're trying to do in a positive fashion going forward. So with that, I think that about sums up everything I had to say. If there's nothing else any of the board members would like to bring up, I will go to public comment. Oh, Mr. Archer.
Yeah, thank you, Supervisor Stopper. So I just want to comment real quick. I completely echo Sam's comments earlier about the Blue Shield management of the allocation. We're going to continue doing what we're doing until we are told otherwise. But the benefit is, and this goes back to the benefit of, although we're a small rural hospital, we're part of the largest nonprofit in the entire nation. So we do have some bargaining power in that sense. And I can tell you, even as late as, or early, I guess, as 10 o'clock last night, I was talking to my regional president who covers 21 hospitals between California and Nevada. She is 100% on board with pushing so that we are not considered just your average hospital, and that they understand, they being Blue Shield, that they understand our unique situation. And we don't have, as Sam mentioned, we're not building a football stadium, probably, at least not in the next few months. Our distribution channels are a little different here. It's primarily going to be through smaller clinics. So I think we have the support we need to make sure we get the allocations and keep vaccinating our community.
Thank you, Mr. Archer. I really appreciate that.
Yep.
Was there any other hands raised?
No, at this time, I do not see any hands raised for public comment on this
No.
item.
Okay, let's give it just a moment, and then for any opportunity. I really appreciate the work that you've all done coming together. We've made great strides, and as Sam, Mr. Leach had brought up earlier, we're literally building the plane while it's in the air. And we appreciate, there's going to be bugs going through any issue. I appreciate the way you've taken extravagant steps forward to facilitate, the best for the community as a whole. Ms.
No public comment at this time.
Okay. Well, if there's no other board comments or anything, we'll move on to item 3. OES, received an update presentation from staff on the January 2021 storm event. Are we prepared for that? I want to thank Mr. Archer and everyone, Dr. Atwall, Mr. Leach, Dr. Beatty, for all being here today. Keep up the good work.
Thank you.
I actually got to head out and take care of some patients, so pleasure joining this call, and look forward to participating more in the future.
Thank you for your time.
Thank you, Mr. B. I'll go back to item 3, OES, receive an update presentation from staff on the January 2021 storm event. Are we prepared, or do we need a moment to get online from OES? We want a 5 minute? Okay, we're going to take a 5-minute break. Well, welcome back. We're moving on once again to item 3, OES, receive an update presentation from staff on the January 2021 storm event.
Good morning, Mr. Chair.
Mr. Ault.
Good morning, Mr. Chair and supervisors. I do have a presentation for you. So let's go to to start things off, there's a list of agencies that I need to extend our thanks to throughout this response, in no particular order. Calaveras Connect, the American Red Cross, CCWD, the National Weather Service, the Public Works team and the Snow Fighters, Ebbets Pass Fire, CAL FIRE, Caltrans, Murphy's Fire, PG&E, the United States Forest Service, and the community members who banded together and checked on each other and looked out, as well as public health and the HHSA staff. So I'll begin this presentation by front-loading what we did when we became aware that we had a significant incident, and that began on the 26th with a National Weather Service advisory. It's the one on the right-hand side of the screen that forecast heavy snow and low snow levels as low as 500 feet, which is somewhat unusual. By the middle of the afternoon of the 26th, the National Weather Service had issued a blizzard warning for the entire western slope of the Sierra Nevadas, including Calaveras County. And this is the map of that area from the blizzard warning. So in response to that, we began immediately publicizing this information so that people that were going to be above the snow line could prepare. We also activated Public Health's Extreme Cold Response Plan and prepared to stand up 3 different warming sites. The warming sites were at Murphy's Fire Training Center, Mountain Ranch Community Resource Center, and West Point Community Hall, the Lions Club. In addition to that, we began a media campaign. We announced the warming centers via public news and social media, and include preparedness tips from Calaveras Connect, the American Red Cross, Calaveras County Animal Services, and the Department of Food and Agriculture for the livestock folks. By this point in the process, Public Works had adjusted their schedules in preparation of 24/7 snow operations to operate around the clock. On the 27th, OES and Public Works coordinated deployment of sandbags and sand to 10 locations across the county. You see the communities here. And again, we publicized that on social media and through routine media outlets or traditional media outlets. We also continued with our public education regarding livestock owners, regarding the ability to dial a ride, a safety checklist so that you're prepared for winter weather. And as a note to that, throughout this process, our social media platforms, which are the only real platforms that give us feedback about the number of people reached, we reached over 15,000 people with this media campaign. That doesn't include the traditional media sources. Needless to say, by the 27th, it's dark and it's snowing. Ebbets Pass Fire is inundated with calls for service, and the first evening of the storm, they handle 40-plus calls for service with their existing engine crews. These are actual pictures from the events that I was able to collect, and it just demonstrates that once it started snowing, it really snowed hard. By the morning of the 28th, in checking in with our partners at Ebbets Pass, we realized that they're inundated and they request help. So we collaborated with Ebbets Pass Fire, CAL FIRE, and OES to stand up a district operations center. All calls to the Ebbets Pass area are now relayed from the CAL FIRE San Andreas Emergency Command Center, which is our normal dispatch center, to Arnold Communications, which was the District Operations Center. This is done via radio due to the power failure, loss of a cell site, landline, and internet capabilities. Due to the heavy accumulation of snow, most of the roads become impassable, and the District Operations Center requests any-track UTVs. The Calaveras Sheriff Search and Rescue Unit, and the Forest Service all answer the calls for UTVs. And we deploy teams, they're mixed teams of cross-discipline folks, deputies, firefighters, and medical folks on these ATVs to answer calls for service. In the first day of operation, which is basically during daylight hours, we handle over 30 calls for service in day one. By this time, Public Works is deployed 24/7. They're out plowing, but due to the heavy snow load and the how wet the snow is, a lot of the smaller plows, the pickup plows, become somewhat ineffective, and Public Works begins diverting equipment from other areas up to the Arnold area. A couple of shots from the area during this time. This is the Search and Rescue UTV. This is Ebbets Pass UTV. And you can see the amount of snow that we encountered during this time. District Operations Center Day 2, 40 calls for service are handled. PG&E begins arriving from outside the Stockton Division to restore power, and Public Works is continuing to plow around the clock. You can see this. Some of these shots are of our good, hardworking Public Works folks, as well as PG&E, and as well as CAL FIRE. CAL FIRE brought us at least two inmate crews over the course of this response, and we deployed them in various areas such as Lilac Park to begin clearing the downed trees in hopes that we could get plows and PG&E crews with greater penetration up these roads to begin restoring power and clearing roads. Operations Day 3, we handle an additional 30 calls for service. PG&E completes their assessment, and they find 477 incidents of damage in the Arnold area, or the 4 corridor, and at its peak, 7,680 PG&E customers are without power. Our plows are still working 24/7. PG&E, being the response partner that they are, sends us equipment to assist with plowing. It was a John Deere 644 loader, which I'll show you here in a few minutes. And by the end of Day 3, we stand down the Operations Center and turn communications back over to CAL FIRE San Andreas. To give you kind of an idea about the typical calls for service that we experienced, they were welfare checks, emergency food and fuel delivery, lines down, medical aids, and trees into, I'll say, objects, everything from houses to cars to lines, etc. This picture, actually, I took it as Chief Johnson delivered emergency food from the American Red Cross. And what is important to realize about this particular photograph is this is the Chief's nearly brand new response vehicle. And it didn't move after we delivered this box 8 feet in 90 minutes. We winched out twice. The snow was deep and heavy, and it didn't matter how good or how old your equipment was, you got stuck in it. So that's us delivering emergency food. Some more just random pictures. This is the county blowing snow, and you'll notice here the depth of the snow is to the bottom of that stop sign. Just kind of demonstrates the magnitude of of what the snow fight was like. This is one of two loaders we were able to bring into the area from Sparks, Nevada. The first one was provided thanks to PG&E. It was provided free of cost to the county, and we operated it for several days. PG&E had a second one that was going to be assigned outside of our county, and when it was no longer needed, Public Works rented it, so we had two of these machines out working. And then last, well, this is Caltrans up working on Highway 4. That was Saturday. By the next Tuesday, the 2nd, we're facing the threat of a second storm with reports of the possibility of up to 2 feet of additional snow. At this point, we still had several thousand residents without power, and it was appropriate for us to proclaim a local disaster, and we did so. That local proclamation requested California Disaster Act assistance and any FEMA assistance available. The important feature to realize about proclaiming a local disaster is that doesn't necessarily impact our immediate operations. There isn't, this holding pin of resources that once we declare shows up and helps us out. What the declaration or the proclamation does is it clears a path for us to begin recovery financially from the state and possibly the federal government once we get through this response phase. So that kind of marks the end of the event. I do have some more slides. Mr. Packinger, are you on, sir?
Yes, sir.
Okay, great. So I'm going to cover some of the initial data from the Public Works Department, and Mr. Packinger, who helped with these slides, is available to answer any questions that I'm not aware of. So it's estimated that there were 243 miles of roads that needed to be plowed during this incident. Now, mind you, that's miles of roadway, two lanes, and each road takes 3 to 5 passes to have both lanes completely cleared. So 243 miles, but 3 to 5 passes is somewhere between 750 plus miles to completely clear all of the roadways. During this response, the Public Works Department had 27 staff from Arnold and 4 staff from Glencoe, and 17 emergency hires working on snow removal and doing the things that Public Works does, clearing trees and things like that. During the course of this incident, they burned over 5,600 gallons of diesel fuel and 200 gallons of gasoline in the response to clear roads. During the road clearing process, initially they encountered 63 trees down and at least 31 lines down across the road. Here were the challenges that Public Works is tasked with balancing. Not only are we trying to clear residential streets, but we're trying to keep up with law enforcement requests and emergency requests for plowing, trees and power lines down across the roadway that we just talked about, obstructions in the right-of-way. And typically what happens here is someone drives a car that maybe does not have four-wheel drive, or a four-wheel drive that does not have chains, goes as far as they can, and then they park in the right-of-way and impede the snow crew from being able to come in and clear. They faced visitors and locals that were unaware of the local conditions and of road laws. They faced equipment failure, citizens unprepared for weather events, mileage versus staff and equipment resources, and of course funding levels. Of course, the public wants no berms in their driveway, no ice or snow on the roads, 2 clear lanes of travel, the ability to park in the right-of-way because of snow obstructing out of right-of-way parking, clear intersections, 24-hour shifts, and of course, no property damages. The basic needs our open roads for basic services such as emergency vehicle access, road surface protection so that we're not tearing up the roads that we worked hard to put down, and keeping the ditches and culverts open for drainage of water and road surface. Certainly not the last piece of the puzzle, but one of the last slides I have here for us is the PG&E response. Miss Pam Purdue, are you on, ma'am?
Yes, good morning, John.
Good morning. Pam is our government liaison with PG&E, and she's available to answer any questions that we have as well. Just kind of a bullet-pointed recap of their response. At the height, again, 7,600 customers without power. All of those customers were restored by February 5th. At the height, they had 70 crews assigned specifically to Calaveras County. And those 70 crews were a portion of the 500 personnel dedicated to this storm response up and down the Sierra. Very grateful that PG&E, again, provided us with snow removal equipment. They supported our warming centers with blankets, portal chargers, and bottled water. And again, in the course of their initial assessment of the damage in the 4 corridor, they located 477 incidents of damages. What that really equates to, some of the circuits in the 4 corridor had to be essentially rebuilt. And of course, our agency rep, Pam, was assigned directly to us for support. And we talked routinely. So at this point, with some of our partners, does the board have any questions?
Ms. Callaway?
I have no questions. Well, I do. John, I have one. Was there any way that we could have used Everbridge since there was no power, no landline, no cell, but people could get texts to have communicated with the community?
We went through a myriad of methods, including flyers, and our local ham operators broadcast some of our information for us. But Everbridge would have been, I don't want to say essentially useless, but would have been after the fact. Most of the cell towers went down almost all the way down to Murphy's, and certainly up over the top. The fire station didn't have landlines until early part of the week after this storm, so I don't believe landlines were working. And without internet, I know that Comcast was down as well as AT&T, that would essentially prevent anybody from getting an email as well.
No, but they could have gotten text messages, correct? I mean, I'm just asking.
No, ma'am. Cell service was down. Without cellular service, no text services, no text messages go through.
Because people were telling me, even as of yesterday, that they could get texts, but they could not. I know the landline. I'll know all that, and so, but they could get texts. I just thought I'd ask the question that was proposed. I think you really captured the concern of the community and the anger that was out there and the frustration. But I have to give kudos to our road department and to they're working 24-hour days, and they're really caring. The other challenges the road department had is there are certain roads that could have only been done by local crews versus crews from Jenny Lynn or Glencoe because of the condition and the design or lack thereof of the roads. So whatever people say, our road department, to me, were real heroes in this. As I also, from my experience watching and being at the command center, the seamlessness between OES, Ebbets Pass Fire, CAL FIRE, all the agencies, PG&E, was very seamless. I truly appreciated it. I know we're going to do a Monday morning quarterbacking on this event at some point, but from my perspective, you all did a good job. There's things we could learn and move from going forward, but to the road department and to all the agencies involved, I thank you very much.
Thank you, Ms. Callaway. Any other questions? I'm going to go ahead and talk, but we're going to let the public know that they'll have a moment. Did you have something, Ms. Foldor? No, go ahead.
John, I have a question for you. How, in the future, we pay so much attention to PSPS and other emergency response, with so many new residents making this their home, how do we empower them to learn more about how to prepare better for the environment that they've just moved to? I know it's not our responsibility, but I think it's a tool that we could promote better on where they can get that information when now living up here. And a big shout out and kudos to Public Works and our partner agencies.
Thank you for that question, Madam Supervisor. It is prudent to do our best to try and educate not only our new residents, but maybe our residents that have never thought about having a winter plan. To that end, we did include a winter plan checklist from our friends at the American Red Cross, and that was made available both on social media and through routine media channels. And that is one of the takeaways that where we can have some improvement is having that readiness become more apparent and promoting individual preparedness for living in very rural conditions and at elevation.
Thank you.
Okay, so I'm going to bring up a few things, but I'm going to let the public know that they'll have opportunity for questions or public comment on this item momentarily once I'm done. So if you're out there and you're listening right now, go ahead and give a phone call in and get on the list for your comments, and I will give you the opportunity as soon as I'm finished. Understanding some of the things you said, the loaders and graders were the equipment that were getting the work done. Much of your smaller vehicles through Public Works were getting mired in the thicker and deeper snow. They weren't able to do the job that was needed. With that thought, and we also, I saw you said we brought in 17 temporary hires, which is a cost, along with which totaled a total of 48 staff off and on shifts, 12-hour shifts for a total of 24-hour days working up in the area. Do we have a pool of money set aside for these types of instances to facilitate using these, or do we pull these from contingency funds? How's this? Where does this money come from?
So I'd like to have Mr. Packinger speak to Public Works, but the one thing that I did leave out of my notes is that this is still an unfolding incident. As late as earlier this morning before this meeting, I filed an initial damage assessment with Cal OES, And as of just before this meeting, the cost and damage for this incident stands at $211,697. And that is where the emergency declaration comes in. Hopefully the governor will declare a disaster for us like he did with Monterey and San Luis Obispo County. And then we'll be able to recoup some of these funds. So thank you for that reminder. And for my portion, I do not have a particular line item in the OES budget to deal with emergencies. And so effectually it comes out of our budget. And then I'll let Mr. Packinger address how Public Works and their complicated funding works. Mr. Packinger?
Yes, sir. Chair, this is Robert Packinger. The funding for snow removal operations is within our regular road department budget. The funding comes from the discretionary gas tax funds from the state. So it's embedded within our different line items, within our maintenance, within our salaries, and so forth. There is no separate snow removal budget.
Understood, Mr. Packinger. Just with the shift of so many more resources needed at a time, I think maybe this is a discussion for the future of having a pool set aside once we get into a position financially to have that pool for such events. At that point, we can work towards getting compensated by the state if they so decide to validate our emergency declaration afterwards, which I would hope the governor would do, considering that I believe the Big Sur area, San Luis Obispo area, I think there's 2 counties down. Highway 1 took a hard hit. That's a major highway, but there's multiple Sierra counties and rural areas that have taken hits, and I would hope that they listen to our needs during this situation also. With that, I'll move on to public comment.
We do not have any public comment today.
Okay, none at this time.
Not at this time.
One other question, Mr. Packinger, and I have immense experience with this from living for years up in Lake Tahoe.
By the end of the second quarter,
Ms. Purdue, your mic's not muted. We can hear you. Mr. Packinger.
Yes, sir.
I've gotten quite a few calls. Basically for most instances, people's driveways when, it's really hard when you're moving a lot of snow for our guys with the equipment they have to not block people's driveways. Typically that's the responsibility of the homeowner or, whoever's staying there to dig themselves out. Is that correct?
Yes, sir.
In the future, I think this comes a lot with, in certain circumstances, we can't make exceptions because then everyone's going to want the same service and we just don't have the resources to do it. But there's certain situations when we get calls on welfare checks and everything, we should keep in mind that in certain instances, after 6 days, people run out of fuel for their generators, and that's not just your typical gas generator. There's some run on propane, and we need to listen and see how we can facilitate be able to get propane trucks out there sooner, because it gets to the point where if people run out of everything, we need to keep it in mind. I understand it's cumbersome to start doing driveways and everything. Certain instances when we bring in OES, sometimes it's a health and safety issue, and something that you know, the county needs to be aware of as we move forward. That's all.
Yes, sir.
Anything else? Okay, we'll move on. There's still no public comment? Okay. So with that, well, thank you everyone for being here and for the update. We really appreciate the road crews, their time, the long hours. Special shout out to Mr. Perry and getting the resources up there along with OES working with them. You know, it was a long haul to get to the point where we are at today for clearing all the roads, but you know, those employees, they went over and beyond, and we appreciate the work they did. With that, we'll move on to general public comment. 30 minutes. Any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agenda may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it is determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30-minute allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as the last item of business in order to provide an opportunity for the remainder of comments to be heard. With that, Ms. Clerk.
At this time, we do not have any hands raised for public comment.
Let's give it a few seconds, you know, for the opportunity. Still none?
No.
All right, with that, we'll move on to the consent agenda. Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for a later discussion. With that, I'll give the board members an opportunity to pull any items of interest. Okay, public members.
I do not see any public
And
at this time.
I assume no staff? All right. With that,
I move the consent agenda.
motion by Ms. Callaway,
I'll second.
a second by Mr. Toffanelli. All those in favor? Aye. Any nays? Passes on a 5-0 vote of the board. That was quick. Regular agenda. We'll move on to item 19, Human Resources. Introduce, after a waiver of reading requirements, an ordinance adopting changes consistent with the modified memorandum of understanding with Service Employees International Union Local 10-1 for certain elected officials and authorize summary publication of the ordinance. Any discussion by any of the board members? Ms. Vollendorf? Okay. Public comment?
No public comment at this time?
Okay, we'll give it a second. None.
Still none.
Okay. With that, I'll entertain a motion.
I'll move this item, Mr. Chair.
Moved by Mr. Toffanelli,
I'll second.
a second by Ms. Fullendorf. All those in favor?
Aye.
Aye. All those opposed? Passes on a 5-0 vote of the board.
Thank you.
Regular agenda item number 20, Human Resources. Introduce, after a waiver of the reading requirements, an ordinance adopting changes consistent with the modified memorandum of understanding with Service Employees International Union Local 10-1 for the Board of Supervisors and authorize summary publication of the ordinance. Any board comments? Ms. Callaway?
I understood that for the Board of Supervisors, it's supposed to be 60 days, not 30 days. I mean, it used to be, that law could have changed.
That, if I may, Madam Supervisor, that is the case for compensation salary. This is benefit.
Okay, thank you.
Any other questions or comments by board members? So what we're saying is the benefits changed, but that we took no extra compensation. Is what
Correct.
you just said.
The changes noted are strictly benefits, nothing else.
Thank you. Any public comment?
No public comment at this time.
Thank you. I'll entertain a motion.
I'll move this item for $522, Mr. Chair.
I'll second.
Okay, a motion by Mr. Toffenelli, a second by Ms. Follendorf. All those in favor?
Aye.
Aye. Is that aye, Ms. Callaway? Yeah. Okay. Those opposed? Passes on a 5-0 vote of the board.
Thank you.
Thank you. Item 21, planning. Conduct a public hearing, find the project is exempt from CEQA, and adopt an ordinance prohibiting the cultivation, breeding, keeping, storing, processing, and manufacturing of industrial hemp, and authorize a summary publication. Any board's comments? Public comment.
No public comment at this time.
Okay, we'll give it a minute. Not a minute, a few seconds.
Still
Thank
no
you.
public.
We do, as Supervisor Stopper, we do need to actually open the public hearing.
Oh.
And
My apologies. Thank you, Ms. Edwards.
Right.
So, I'm sorry. I gotta get down to the item here. Make sure I state it properly. I opened the public hearing. It's fine. We'll just get to that.
and I believe Mr. Maurer probably has a presentation for, a brief presentation for the board.
If Mr. Maurer would like, I didn't see the board had many questions.
I can forego a presentation. I think the staff report is pretty self-explanatory. There was one minor correction that we needed to make in the findings, number E. Julie, do you have the number as a reference to a code section? And I think we just have the wrong code section in there.
Yes, it should be 4900 at C.
So other than that one minor correction, we do not have any anything else to present to you unless you have questions of us.
Thank you, Mr. Maurer. So with that, you know, if that's the only thing I'll give, that would just be as amended, as you suggested.
Yes.
Okay. Ms. Edwards, should I close the public hearing prior to accepting a motion?
You will want to close the public hearing prior to soliciting a motion. So long as none of your colleagues have any comments or questions and no one from the public has any questions, then you could certainly do so.
All right, so I'll double check with each one of my fellow board members. And is there any public comment hands raised yet?
Still no public comment at this time.
Okay, with that, I will close the public hearing and I'll entertain a motion.
I move we adopt this ordinance, waive reading, prohibiting cultivation, breeding, keeping, storing, processing, manufacturing of industrial hemp, and authorize summary publication.
As
amended.
suggested.
As amended.
Thank you, Ms. Callaway. A motion by Ms. Callaway,
Second.
a second by Mr. Toffenelli. All those in favor?
Aye.
Aye. Any opposed? Passes on a 5-0 vote of the board. Thank you, Ms. Edwards, for setting me straight.
No problem.
And that, we'll move on to item number 22. Division of Cannabis Control. Receive a quarterly information report from the Division of Cannabis Control.
Good morning, Chairman Stopper, members of the board. My name is Greg Wayland, the Director of Cannabis Control, and it's my privilege this morning to provide you a status update after year 2020 when our program started, and of some of the milestones that we met in 2020 and some of the things that we're looking forward to in 2021 as outlined by our staff report, and look for any direction and commentary from the board on those things. 2020 was an important year for our program. We accomplished a lot in terms of permit issuance of CBCBs, and building out our program. In the year 2020, we issued 35 permits, approximately 229 CBCBs. The board passed a resolution calling an election, and the voters of the county adopted a new tax measure, which came into operation on January 1st, 2021. And in calendar year 2021, we're looking ahead to different changes to help build out what we've already started and help our industry and local economy with further amendments potentially to Chapter 1795. So what we've prepared today is what we call a metrics update. It provides the board with some timelines and statistics on our revenue, on tax revenue for the calendar year 2020 and 2021. In terms of our operation, we're now at 38 permits. We have approximately 30 conditionally approved applications, and we're expecting a busy year in 2021. So what I'll do is, if I can share screen. So as I mentioned, this is intended to be a regular update. We plan to bring these periodically. Our last one was in August of 2020. And at that time, we offered and expected to deliver on providing the board with an update on our revenue as a department. And it's important to draw a distinction between what the board is looking at here is revenue from fiscal year 1920 and revenue in our first quarter of fiscal year 2021. And because we offer some data on that distinguishes between a fiscal year and calendar year, what we're referring to when we're talking about our budget and what these numbers represent is the fiscal year, meaning from July 1st to June 30th of 19 to 20, and the same from 20 to 21. Measure C and Measure G, which I'll be presenting some data on in a moment, are sort of captured in terms of calendar year, and that's based on the way that the ordinance is structured, and to allow a simple and effective way to implement this and interface with the industry locally. So I'll get into some more data on that in a moment. As I mentioned, we interface with a number of departments at the county. It's been my observation that we've managed to integrate well with a number of departments, including the Sheriff's Office, the Building Department, and Planning, and each of these departments has done an excellent job in integrating with us and executing on tasks under Chapter 1795. And so last fiscal year, we saw revenue of approximately $773,764.78. These represent application fees. So that's to be distinguished from, for instance, Measure C, revenue that we received in calendar year 20, which I'll present on in a moment, which was approximately $1,070,000. These are fees paid by applicants that fund the permitting process and the CBCB process at the county. Because we are a fee-funded department, that's where our operational costs come out of. What you'll notice is that the revenue from last fiscal year versus the first quarter of 2021 shows a disparity because our industry is, I guess, could be characterized somewhat as seasonal in terms of when their business needs dictate that they proceed with applications versus pay their fees, because it is a sophisticated and complicated process for them to apply with us, complete our environmental and regulatory compliance, as well as the state, on top of their own business investments, be it in property and personnel. So, for instance, if someone were applying last fiscal year, they may not want to proceed with their application until some point in the future when they know they're going to get a full season out of their application, because once they have been permitted, for instance, now under Measure G, they're paying tax based on our new canopy tax that became operative on January 1st. What you're seeing in the bottom number, the $841,458.78, is our revenue from application fees paid from the beginning of our program. This slide provides a further breakdown of these fees and where they're coming from. What you're seeing in the left column, right under the label regulatory fees, are our application fees that an applicant would pay for a commercial cannabis cultivation permit. And the total revenue there is, from the beginning of our program, $803,965.78. We also receive fees for processing cannabis background clearance badges, which we operate in-house. We have the vetting process set up that we've presented on in the past. It's a process of applicants submitting to the Cal DOJ for their worker badges, and we review those against Chapter 922, which provides the criteria that we pass or don't pass an applicant based on. Those fees total $33,705. And then appeal fees are our cannabis cultivation application appeals. And there have been approximately 15 denials. And of those that went to an administrative hearing, what you're seeing here is the total number of fees being collected for those appeals. And the total of all of those together is the $841,458.78. In terms of expenses, last fiscal year, being 19 to 20, we incurred approximately $232,726.06. In the first quarter of fiscal year 2021, which would be from July 1st to the end of September, we incurred $81,481.85. The total amount of our expenses from the first quarter to the beginning of our program is $314,207.91. We wanted to provide some greater detail and get a better granulated view of where these fees are being spent. As I mentioned, we are a program that collaborates with a number of county departments, including planning, building, and code compliance, the sheriff's office, in order to fully execute Chapter 1795 and 9.22 of the county code. So what you're seeing here on the left side is the regulatory cannabis program fees. And these are fees that we incur or that we utilize to review cannabis cultivation applications for compliance, site inspections, plan reviews, etc. These are for the cultivation permits. On the right-hand column is our CBCB program with a breakdown of the individual costs to administer that program and get it started. And together, these total $232,726.06 for fiscal year 1920. And if I am moving too fast, I'm happy to go back and entertain any questions that you may have on any of these slides. In terms of our expense breakdown for the first quarter, the same program for cultivation permit processing was $66,761.73, captured the first quarter of 2021, and that's through the end of September. On the right-hand side, you see the CBCB program expense of $4,571.64 to process CBCBs. And the bottom portion of this slide has a table depicting what our reimbursements are to other county departments for their role in processing these applications. In total, that was $81,481.85. To date, our total revenue has been $841,458.78 of application fees. Our total expenses, $314,207.91, and as of the end of September, we had approximately $527,250.87 remaining. It's important to note that these are regulatory fees paid for a program, and so some of our permits, as I'll get into in a moment, we have applications pending that goes across fiscal years, and so these programmatic costs follow that application, and we're able to continue processing those with the fees that they've paid. We have to date issued, it's actually 38 permits as of today. We issued another one after this presentation was prepared. There are 27 withdrawn, 15 denied, 8 under review, and 24 with corrections needed. Conditionally approved applications are 30, and applications in applied status, there are 26. Conditional approval is an important portion of the application process because they've gone through our pre-application review, so they've demonstrated that they meet basic eligibility criteria, and from that point, they've paid their fees and have been directed outward to other county departments for more in-depth reviews and inspections, such as planning and building. There were 30 of those, and so these are applicants that are fairly advanced in the process and have a high likelihood of following through with their application this year. This slide shows an average timeline for our applications that have made it to permit issuance. So this is from the time that they first applied with us through the time that their permit is issued. And that timeline, we had the first permit issued May 15th of 2020, and the last one August 26th of 2020 in calendar year 2020. And what this shows is sort of an average timeline that it takes to complete that process. And one thing that I want to note about this is that our application process is what I would describe as, it's a front-loaded process. So what I mean is that when they apply with us and they submit a pre-application, they're providing basic details about their operation, and their vetting process begins at that point in time for full compliance with 1795. At the same time, they have the opportunity to apply with the state to complete their state licensing process, and combined along with the business aspect of this, the acquisition of land, organization of their own internal business operation, this is what the timeline has looked like. It's an average of about 179 days. It's possible that this could probably look a little lower, somewhere around 150 days, but generally speaking, this is what it looks like for the average applicant to reach a permit, at least in calendar year 2020. I will note that 2020 was in some respects, presented unique challenges for the industry, especially with respect to COVID. It's not yet clear how this is going to look in this calendar year, but we expect that as we've adapted, as they've learned about our program, and as we move together with an understanding of how each other's processes work, that this timeline could decrease. But there's a number of factors that play into this as well that just make this process something that requires time to complete. This graph depicts the total number of our current applications that are not withdrawn, denied, or issued. So these are pending applications and the average amount of time that they've been pending with us. And what you'll see is interesting here is that some of them are at around 400 days of pending status. And this sheds light a little on what I was referring to earlier, is that this is a process that they have to plan carefully. Generally speaking, if they're going to go through with full issuance of the permit, it means that they most likely are expecting to have a year of with some form of revenue, or are actively utilizing their permit because of the costs of state licensing and our regulatory program. So from the longest pending application to the shortest, you can see that it goes across the full spectrum of time, right up to the time that our program started about 400 days ago. So these represent all of our applications, and included in this are those 30 or so conditionally approved applications, which are working towards full compliance with 1795 and are most likely to, and at least in this calendar year, complete that process. In terms of our application denials, there have been a total of 15. It's approximately 9% of our applications. And the primary basis for the denials has been a transfer insufficiency. For instance, there have been prior code cases or sheriff office warrants being executed on a prior cannabis site, or the prior registration was denied, or CDFA license not issued or applied for properly. This is a part of our basic eligibility review. I've mentioned this in previous presentations that under 1795-050D1, we have some basic eligibility criteria that is referenced in the October 22nd, 2019 CEQA addendum. These are criteria that we apply fully and fairly to all applicants, and the result is this 15 denials out of our application pool. In terms of our CBCBs, we have approximately 60 in process right now. We've issued 23 temporaries and 229 permanents. There have been a total of 2 denied, and in all we've had 314 applications. This has been an interesting process, and one that the Division of Cannabis Control may want to look at in the future, because while we're building out our CBCB permit holders or badge holders, the industry in the meantime is somewhat unique in that at times of the year there's a surge in demand, whereas the available pool of workers who have issued permanent badges, it may or may not be able to meet that, or logistically it may be difficult for our permittees to obtain the help that they need at the time that they need it. This is an aspect of the program that we will likely want to look at in this calendar year to potentially see how we can best answer the demands that the industry has for those surges of workforce need. As of today, we have approximately 131 rights to apply that are in play. That's a utilization rate of approximately 66 to 69%. It's a relatively high number, and of course in those is the 30 conditionally approved applicants, and those basically who have not either withdrawn or been denied. The total rights to apply left that we estimate is approximately 59 to 69 of them. And this is also based upon the CEQA addendum and previous studies into the availability of these rights to apply. We estimate there's somewhere in the neighborhood of 190 to 200 total available rights to apply. And those are prior registrants who qualify under 1795. Their right to apply is utilized in a current cannabis application to cultivate. And that had the effect of somewhat tailoring down the number of permittees that we can have under the current program. And so what we're seeing right now, again, is a utilization rate of somewhere between 66 and 69% at this time. So, as I mentioned before, the board passed a resolution in July of 2020 that sent a tax measure amendment to the voters of the county. And on November 3rd, 2020, that was approved by the voters by 64% approximately to 36%. It became operative on January 1st, 2021. And it's a cultivation tax based on canopy square footage. This was an important objective for the Division of Cannabis Control last year, to be able to bring this to the board according to the board's direction and implement this as something that we think is easier to administer, fairer, and has some administrative and enforcement improvements built into it. While our revenue for calendar year 2020 under Measure C was approximately $1,070,000. What we're expecting, at least based on the current amount of permits and the square footage that they represent, is a projection of somewhere in the area of $2,692,080, based upon the breakdown in square footage of indoor, outdoor, and mixed light corresponding to these amounts of square footage and the applicable tax rates. Under Measure G, these would be paid in installments in 4 calendar year quarters. So the first one would be due at the end of March, and then every 3 months after that. And that would break down to roughly $673,020 every 3 months. As I mentioned, there's some enforcement and administrative provisions built into Measure G, including delinquencies exceeding 60 days or chronic noncompliance provision that would give us the ability to have some enforcement mechanisms available to us should the need arise. Hopefully it does not, but that's built into the code. So, in general, what we are looking at and what we've outlined in our staff report is some of the things that we're looking at in calendar year 2021. And that includes bringing to the board, if the board's direction is that this happen, a permit license type for distribution and testing. Distribution is an important component of the industry. It's a distinct license type that is essentially the commerce piece, and it allows our cultivators to be able to transfer products, and it's actually fairly versatile in that distributors can also perform a number of other things, including packaging, labeling, storing, and essentially they provide a very important piece of the local industry. Right now, under 1795050B, what our cultivators are able to do is utilize out-of-county licensees who are licensed by the state. And so what we're essentially seeing is that they're reliant upon these out-of-county licensees in terms of their availability, in terms of their pricing, and we have a major component of this industry missing from our local economic ecosystem. What we'd like to be able to do is bring this type of license back and be able to folded into our regulatory program into 1795 and enable this to essentially provide a more sustainable and beneficial cannabis program here in our county. I have invited Catherine Galino, our Economic Development Director, who's had some insights on this and has also experienced the same type of concerns from the public about our not having this available to our local industry and economy. Kathy, if you're present, if you wanted to offer any type of comments on that.
Absolutely. Can you hear me?
Yes.
Great. So, yes, I have had several conversations, and just from the economic standpoint, to see any type of leakage of commerce, tax dollars, employees leaking out of Calaveras into other counties is not a positive thing. We really want to capture that revenue and keep it here in Calaveras. In talking to some of the growers, they would like to be able to have the option for transport and testing, storage, and labeling. And I mean, ultimately, hopefully to the manufacturing phase, where we could completely close the loop 100% and capture and maximize all of the dollars here in Calaveras. So that's kind of my little snippet.
Thank you, Kathy. I've also invited Peter Maurer. He's on standby, our planning director, in case there are any questions directed towards what a rollout of the distribution license type may look like from a planning perspective. We've had discussions on this, but we are essentially awaiting board direction on that program. So with that, I'd like to turn this over to the board, and if I can answer any questions you may have, or if you want to revisit any of the information that we presented on, I'm happy to do that.
Did we lose Mr. Moore? Oh.
I'm here.
All right. Thank you, Peter. Good to see you. Does he? She was answering me. Is it? No? Mr. Garamendi.
I'll go first. Greg, thank you very much for that report, and Peter and Kathy, thank you for all the work that you guys are doing on this stuff. I like this slow, steady, thoughtful approach that we're taking. I really appreciate that work that you guys are doing. I get a lot of calls, people always asking if we have any intention to open up additional licensing. I usually tell them no, but I thought that's not my decision, that's a board decision. And so I wanted to sort of see where everybody was at on that issue, just so we have clarity, because I'm sure if I'm getting the question, I'm sure Greg gets the question, I'm sure all of you get the question too. So I think that might be one of the first things we just check off is where do we sit on that?
With that, thank you, Mr. Garamendi. I would like to ask a question of Peter. If we were to open up more licensing, would that impact our current EIR and create a larger imprint or footprint, let's say, that may bring us out of compliance or whatever with the California Environmental Quality Act?
Well, we based our analysis of the regulatory program on the limited number of applicants in order to be within the scope of the original EIR. It would depend a lot on, what the board's direction was as to how you might consider opening up further. If it stayed within the constraints of the EIR, we could, analyze it under that. But if it went beyond what the EIR anticipated, then that would open up new CEQA analysis.
So essentially what you're saying is we may have to go, if we open it up further, we may have to go through another environmental impact report?
Well, we certainly need to look at the CEQA implications, whether it raises to the level of an EIR or could be done under some other document would have to be looked at the time that we know what the parameters of the ordinance are. But yes, likely that would be the result given the issues associated with cannabis cultivation.
Okay, thank you.
And if I could just very briefly piggyback on Peter's response, which I agree with, I think the same answer would be true for expanding to distribution.
To a certain degree, depending on how far it was and the possible implications per CEQA.
Correct. When I say the same answer, as Peter said, it would require looking at the existing environmental documents and looking at the proposed scope of adding that and seeing whether it's something that was already contemplated or whether there would need to be additional analysis.
Thank you, Ms. Edwards. So, Mr. Garman, your question is, does the board have appetite for expanding permits for cultivation use at this time?
That's correct, sir.
I'll follow up with that. Personally, I see it the same way as you do. This process has started forward very slow, which was what a lot of the people coming forward were asking for in the beginning. Don't go too fast, don't do all these at once. I think we've done a very strict ordinance that's slowed it to the point that, we can, 30 permits so far that are active, and then, potentially more next year, but, nothing over 200. I agree that, that's a conversation for the future. Let's fill out the permits that we have now, and then look at, how well things are running in the future when it comes to the cultivation. And if we're being successful, then it would be a good time for that conversation. Is there any other board comments on that? Or is anybody in disagreement with maintaining where we're at with the cultivation permits now? Yes, sir.
Yeah, I think we still have a long way to go with the 190 to 200 that we have. We've only got 38 as of this morning approved. So maybe we have a conversation in the future once we get to half of them, 50% of them approved, or wherever we're at. However long that's going to take, according to Greg, a lot of them are already on far down the road to getting approved. Some have been withdrawn, and then 15 have been flatly denied, but those being withdrawn doesn't mean that they're denied. For some reason, they didn't have their ducks in a row or whatever ready to go forward, so they withdrew their application for now. So if you look at all that and put it together, I maybe in the future, sometime in the near future, but with only 38, I'm in agreement with you, Ben.
Yeah.
I would, I would like to see more of it than half. I'd like to see us well into the 100 permits utilized so we can really see how this is impacting the community and how this is working. I like this cautious approach, if nobody opposes that.
Agreed, and, I think possibly, let's not set any determined number that as we get updates, because Cannabis Control is going to continue getting us updates, we can bring up the conversation as we move forward in the future so that, we're fluid with how things are going. Because, if things start going bad, then we don't want to necessarily just open it up. Ms. Follendorf, or Ms. Calloway.
I had more questions.
I'm giving them the opportunity to talk on this thing that you brought up, Mr. Garamendi. Ms. Calloway, no?
Just different, but Supervisor Garamendi, go ahead.
No, I was just, I'll circle back on the rest of my questions. It's okay.
Okay.
I had a follow-up to Ben's question to Mr. Maurer. With the scope of the EIR, if the testing was applied to other industries, how would that work? I.e. water testing or, because there's been conversations about multi-commodity being able to go through the same facility. So I just questioning that scope that you mentioned. And if there's no answer, that's okay. I just, in the past, there has been that conversation. Why, for other ag?
So right now, a testing lab that does anything other than cannabis could open up in a variety of zones in the county based on the current code. The EIR contemplated that there would be distribution and testing and even manufacturing to some degree, and so we would just have to look at how that would impact the environment in the context of what was already analyzed. There would be nothing that would prohibit a testing lab other than what restrictions there might be in state law to having a testing facility that has a broad range of testing capacity, not just for cannabis, but for other agricultural products or other food products. If looking at if there are residual pesticides or anything like that, in a food product. So that kind of use, the only thing that's unique is the fact that cannabis is such a highly regulated commodity because it is new to the state, new to the county, and so there's just a lot of overlapping rules and regulations. And we've taken a cautious approach, as other board members have pointed out, that we want to move slowly on this. But I think that we could certainly look at providing an avenue for testing within the constraints of the EIR and come back with a draft ordinance that meets those requirements. Did I answer your question?
Yeah.
Good.
So right now, let's just to answer Jack's first question, I'm seeing a majority appetite of the board to remain where we're at with the cultivation permits, and then we'll bring it up later as we proceed forward. Mr. Whalen, you can check that one off your list. We'll go ahead and move on to Ms. Callaway and any questions she has, and then I guess we'll go back to Mr. Garamendi post, unless someone else has questions.
Mr. Whalen, I think having stakeholder meetings is a good idea. I like that suggestion in your staff report. What about revenue from adult use sales? Does any of that go through you, or does that all just go into the sales tax? Does that impact your revenue in any way? And is there any expense that would accrue to your department?
So the short answer is that is computed into what our Measure C tax paid in 2020 was. The payments are made to the tax collector, of course, and we have our independent funding source in our application fees. So it was factored into the total approximate $1,070,000 that we received under Measure C. It does not impact our program in any significant way, and we are not reliant upon it. There are two separate and distinct things. Is something that's important for me to make sure that I adequately represent, is that we are a fee-funded department, and Measure C previously and now Measure G taxes are something that is a separate and distinct thing. It's a general fund revenue based upon our tax ordinance that's paid to the tax collector.
So the adult use sales are not part of that equation, correct, of what you gave us?
Correct.
Okay. Why do you think you're going to be especially busy this year? I mean, of course, you're not going to tell us you weren't busy last year, but I mean, in terms of the number of applications, what do you think is causing that increased movement this year?
I think that there's a number of factors. It's it would be hard to underestimate the impact of a new industry and a new program and working through a permitting process for the first time. And to begin with, as I mentioned before, the most difficult parts of our application process is it's a front-loaded process. So they need to apply with us, demonstrate basic eligibility, and from that point they go out to separate county departments. So I think that now that we've had an opportunity to complete a year of that, the industry has some experience with how our local regulatory program works, that I think you're going to start to see some efficiencies sort of build in there, some expectations based upon the history of our program now. I think that that's an important part of it. As we adapted in 2020 to a change in basic circumstances, accessibility, and the availability of different types of the features of our program, like background checks, there's different components of that I think are going to be somewhat more expeditious in 2021, just because we have honed our program so well to deal with prevailing circumstances. We work very efficiently, and we have built greater efficiency with other county departments over time. I feel very optimistic about our level of compliance with other departments, our level of integration with our programs, the way we've worked so well over the past several months. I think you're going to see that start to show in terms of how our permittees are able to reach the final permit stage. And then I think that just because, as you saw from the slide previously, there are a number of applications that have been in pending status for quite a period of time, some of them as long as almost 400 days. They're starting now at the beginning of the year, and they already have some work done on this. They're invested in the program. They've made it a way down the line on our review process, and they have the entire year ahead of them. So you may see a lot of them start to move more expeditiously on their own applications too. So there's a number of factors that I think will come into play in 2021, where you'll see that we will be busy as we were last year, if not more, processing applications and bringing forward additional program improvements or changes, such as potentially the distribution license type and the industry interfacing with the periodic meetings, so that we can learn about issues that they're seeing in the industry, and they can hear from us on specific subjects that we may be able to present some data on in terms of our own program, things that are coming down from the state, different changes that it's just helpful for us all to share knowledge on. So there's a number of factors that come into play in my anticipating that 2021 is going to be a busy year, and another year where we accomplish the goals of our department and board direction.
I'm having trouble getting the concept of the 179 days to the 267 days on the in-process pre-application and pre-application to permit issue. Is that because cultivators are just sitting on their application before they do a formal submittal? I mean, that's a significant difference.
I appreciate that observation, and that's a great question. And the answer is that it's actually complex, because there are different regulatory agencies that the applicants work with throughout this process. And that's dependent on all of them, including the applicant themselves, deciding, being in control of their application, what is the right time, and logistically, how do they roll this out? They go to the state as well for their application process. And generally speaking, in my experience, state license has been the last piece that I would say most often is the last piece that we are needing in order to complete our permit process. And that's why I would say that it's complex, because it is actually beginning a business for them. It's completing the state regulatory, the full gamut of what the state requires from them in terms of their licensing, and then fulfilling our application process in terms of site diagrams, information about the business, the type of operation that they want to have, and then the legwork in between of documentation and plans that it requires. And not to mention the costs of the state local program as well as their own business costs. So it's a complicated process. And so what we see in terms of the timeline for permit issuance is, in my opinion, it's reasonable. It's something that we would expect to see.
Okay, complex. You sound like Mr. Leach. One other question on under Measure G. I understand the tax based on canopy, and that's based on, I submit my application, I'm going to have 5,000 square feet. And maybe I want to make a change, a year down the road, increase it by 500 or reduce it by 500. Is there a mechanism that they can do, that a grower can do and pay a tax, since we do field checks anyway? Because when they submit something, it could be different than what might actually happen in terms of operation.
So the tax ordinance itself is fairly rigid in terms of how tax is assessed based on square footage. There is some grace provisions built into it that are there for the tax collector and the board to consider. But as far as the basic taxing and the square footage basis of the tax, it's pretty rigid. So one of the things that we are working to roll out imminently is building a application process for modifying premises. So that is one of the things that is a top priority for us. And we expect to be able to bring that to the board as soon as possible. So that would be an application process that allows for certain modifications to the premises. There's other fees involved as well with respect to other changes on a premises and with a permit that we're also working on. But this one is a top priority because we do recognize the need to fully develop our fee structure and our application process to accommodate that.
Okay, thank you. I'm not sure, of course, where the board is, but I definitely would support having staff look at distribution, manufacturing, and testing as it relates to our EIR when that becomes part of maybe direction today. Thank you, Mr. Chair.
Mr. Garamendi?
Thank you, Mr. Chair. I think I'll follow up on where Ms. Callaway left off on the distribution ordinance. I too would support taking a look at that, seeing if staff, how it would fit under the current EIR. I would think of it in terms of distribution of, if you're running a winery, you could load up the back of your car and take it down to the farmer's market or wherever you're going to sell it and do that yourself. But you can't so much do that with spirits. I think we are, as Kathy put forward, hobbling ourselves a little bit. And this might be a hole that we just didn't fully understand when we wrote this ordinance. I don't know. I'm a little more cautious about manufacturing and heading to the big thing. But I think as far as finding a way to deal with our local growers that they could actually transport their stuff to the testing site or to the retailer, I would like to do that. So to Ms. Callaway's point, I too would support staff taking a hard look at distribution and seeing how it fits and maybe bringing something back. I'd be a little more cautious than perhaps Ms. Callaway on manufacturing, but I don't see any reason we shouldn't take a sniff at that as well, seeing how it all fits together, but certainly Part A distribution.
What about testing?
Yeah, sure. I mean, I think we could take a look at all these things and see where they fit in. If I had to make a prioritization, though, I'd put distribution at the top and then the other two underneath them. At least that's my opinion, just following up on what you suggested, Marina. I don't know where everybody else is, though.
If you don't mind me following up on that, Mr. Garamendi, I'm in favor of looking at the distribution thing. I think Peter said it well about testing, but the hard fact of it is we do have areas where there's labs, so maybe we can stay underneath that same imprint or footprint, let's say, for testing, but we don't have a lab here. And I know through my experience in my other job, heavy metals testing is not usually done at any lab anywhere in any foothills. It's sent out of state for the most part for a long set of tests, and that it's very hard to facilitate. So, I mean, we could open that up, but at the same time, it's no one has the money to invest or willing to invest in Calaveras County for when it comes to heavy metals. The other agriculture type testing and everything else, would favor our area, and then manufacturing, I just don't see how it fitting underneath our ER now. I mean, sure, look at it, but I don't really have the appetite for that at all. Any comments from any other board members on what Mr. Garamendi brought up?
I think a cautious look at it would be a good idea, knowing that there's still more to learn. I still do support the more that we're able to regulate certain aspects of the industry and it goes through the department, knowing who's coming into the county. Right now, we don't know who they're using. We don't know who's coming in. And I think that is a loop that needs to be closed. And if we're able to bring more jobs and make the process easier, we should be open to the opportunity, but I don't think a full-blown, what Ben said, Mr. Chair said, let's be cautious about it, on it. But I'm in full support of regulations and safety of all of those things.
Mr. Toffanelli.
Thank you, Mr. Chair. Yeah, as far as the distribution part of it, I'm interested. We can take a look at that and see what staff comes up with to present to us. The testing, I don't, even if you open it up, I don't see that happening because the testing lab would have to have more broader aspects than just testing cannabis at a certain time of the year. I mean, you're just not going to build a business on once a year bringing something in and have it tested. You'd have to have other broad, and I'm not sure that that's going to come here into Calaveras County. If it does, it'll be a long time from now. Because even the ag producing part of it, the other part of ag, I don't think there's enough here specifically to support a lab. And as far as manufacturing, I'm kind of on the same page as Ben on that. I guess we can look at it, but I'm not certain that that's going to be something that we can do here in Calaveras County either. But certainly the distribution, Peter and his staff can come up with something that fits in the EIR. We can look at it, talk about it, have them present it to us.
Very good.
Supervisor Toffanelli, if I could.
Yes.
Hi, I'm Jessie Fowler. I'm the Agricultural Commissioner. I just wanted to add, as far as accredited labs, that there's only approximately 10 in the state currently, so it is a long process both for hemp and for cannabis. That's it. Thanks.
Thank you.
So, Mr. Chair, I would, hearing what everybody says, I might suggest, if there's one thing I've learned in my 4 years on this board, the more detail we give the staff on direction, the more we're going to get a focused effort by them. I would listen to everybody. Maybe I would modify, maybe there's a poll that could be taken, but I agree. Let's figure out the distribution. I don't see any reason, and we'll see what staff comes back with on that. But I think we have to get that figured out before growing season starts. So I would maybe push that to the front of the list. And then, we have to decide whether that's for everybody who's got a license, a legal license. Do we want to open up to people from the outside? I'm not so sure about that at all. But it would be great if the staff could get back to us with something on that, on distribution.
Any more detail to that?
I have one more question, one more point, but I'll circle back.
No, I guess I look at the testing a little bit different than Mr. Garamendi and Mr. Tuffanelli. It's a business, and it isn't our decision to say it's only a crop once a year, because there's indoor growers who are growing year-round. And it's a business, like Ms. Fowler said, that there's not many of them in the state. So we could have a testing site in an industrial area, and they're doing testing for other grow sites throughout Northern California or the San Joaquin region or wherever. And so it's a business that they establish, and it's up to a business person to decide if they think this is a location they want to do it. I mean, 10 in the state for a product that's as large as this industry, I think there's a market for that. And when we discussed it early on, 2019, I'm just talking since Mr. Stopper and I were on the board, have been on the board. But to me, testing is a business that could be cultivated, and we're not talking about a testing lab in 3 parts of the county. We're probably going to be talking about one testing lab, and if they can bring in business from elsewhere in the area, more power to them. And it's another component of the industry. And I'll back off on manufacturing if you give me testing.
I think Marita makes a very valid point.
She does, absolutely. And it's not just for ag or per se cannabis. It's also for the water industry. I mean, the last time we had any local foothill lab open, it was in Jackson. It closed down near 6 years ago. And, there's multiple services that they can provide beyond just the cannabis issue. With that, it's a major investment. It's not an easy business to make money at, but you know what? If we open it up, for a narrow area that's not a big footprint, maybe someone will bite. I mean, I'm fine with that.
Me too.
Mr. Garamendi, you had another question?
Yeah, one more thing. Greg mentioned 9.22 and the CBCBs for labor. I think we all saw this. Anybody who works in ag knows that you need a whole lot of labor for a very short amount of time. And it turns out that cannabis is no different than most ag. And I think we need to figure out how we're going to do this. If we don't figure out how to solve this, we could have a lot of, we could be forcing people to break the rules, and they don't want to. I don't want to take people who are businesses that have gone through all this effort and put them in jeopardy because the plans that we put in didn't work. That's what we're working out here, right? We're reviewing what works and what doesn't. And I'd be curious I don't know if the sheriff's on the line, but I'd be curious what he thinks about the 922 and the CBCBs, and if there are any suggestions he might have on making it. We're supposed to be sitting here looking at this, figuring out what worked and what didn't work. And I'm worried about that piece didn't quite work the way I thought it was going to work. And maybe it will over time, but So we're dealing with within this calendar year, what are we going to do? And I'd like to figure out how to solve this.
Mr. DiBasilio, are you on?
I am.
Hello, sir. Did you understand Mr. Garamity's question?
I did, and I actually had a couple of folks, couple of business owners call me and ask me about that. And I understand it is a major concern. I understand that there is a lot of people needed for a very short period of time. I don't know what they're using for services. I would suspect that if there was a business out there that was doing background checks that would say I owned a business and I needed 10 people, and all of a sudden I could only get 6 of them because I had to send 4 of them home and I needed 4 more, I would think that business would have these people already background checked. I don't know what the industry has as far as personnel available, how many services that are out there. Again, it goes back to what I talked about when we originally started this program, is the concern on who's on site when not so much us, because we're not dealing with it so much, but Cannabis Control Office shows up on site, that they know who they're dealing with for their safety. I have a lot of respect for these business owners, that they are exactly that. They're business owners, and I know that they're not going to want to do anything to jeopardize their business, like Supervisor Garamendi just mentioned. I don't know if the option would be to make sure that they get a valid identification of some sort that the business owner would have to maintain, so that if somebody from Cannabis Control or the Sheriff's Office showed up, that we could say, okay, who's that person standing over there? They can say, this is who they are, and here is a copy of their driver's license or whatever form of legal identification that they have. I think maybe putting some of that pressure on the business owner to make sure that their people are in compliance might be an option. So that's just a suggestion.
Yeah, no, I mean, I was stoked when I saw that, 325 people got CBCBs. I mean, that's half the peak workforce at cement plant when it was running. And these are people that are distributed, but those are jobs. And people are paying to do this, so those are real jobs we're making. My concern is about, not the 4 or 5 guys you've got working on your farm or your ranch year-round. My concern is about the 30 days that you need, or 60 days that you need a lot of hands, and I don't know what the right answer is. I had always had the hope that there'd be some sort of large pool of people who were available, sort of a hiring hall type thing, but that's going to take a long time, and nobody's stepped up with that business yet. And maybe it'll be like testing, it'll come. I just would like to find a way before we get to harvest to solve some of this problem, and I don't have a solution. I agree with the sheriff. The employers should be responsible, but we also have to be responsible in how we approach it. So I don't have an answer, Mr. Chair. I'm clearly just kind of restating a problem and seeking one.
Mr. DiBasilio had a suggestion, possibly for, as you said, temporary workers, 30 to 60 days. We could have Mr. Whalen will look into that and possibly bring that back before the board for further discussion and action.
I would prefer that, but
this is the good kind of thing. The stakeholders meeting, the sheriff and Mr. Whalen get together, come up with something that works for them and for the county, and make the presentation to the board.
Chairman Stopper, this is Greg Whalen. That's something that would be feasible for us to look into and facilitate with SO and the industry to get some ideas on the way that might look best and function the best, because there is a very real need for surges in labor force that we need at specific times of the year that is very short term. I would be happy to work with the sheriff's office, and then other county staff, as well as the industry, to try to find a way that that could be presented to the board in the best manner.
Any comment to that, Mr. Toffanelli?
Greg, do we have any idea what type of numbers you're talking about? Have you had any conversations or any idea? I mean, we've had a total of 314. You've issued 229, temporary 23, so that's about 250, and then in process 60. Only 2 have been denied according to your chart. So are we talking 600, 1,000? Do you have any idea what type of numbers you were talking about?
It'd be something that I would need to study closer to put some data together that would be more reliable. But I will say that the processing time of the year is very labor intensive, and it has to happen on a short timeline. So we have issued the number of CBCBs, 229 permanents, 23 temporary, and that number's probably gone up since this presentation was put together. But the logistics of connecting these workers exactly where their demand is at any specific point in time in a short time of the year when everyone needs them is something that we should look at because I recommend that we look at it because that is logistically very difficult, and I can put some better numbers to that, Supervisor Toffanelli, but my observation is that there are quite a few workers that are needed in a short amount of time.
Well, I just did a little bit of math on what we have here in front of us, the 229 plus 23, and then divided by that by the 38 permits that you've issued, which gives about 7 people per farm. And I don't know how many they need. I have no idea whether they need 10 for an acre. They need whatever they need. I think this is, again, I'm going to have to agree with Marie that perhaps you need to get with the industry work group, the sheriff, and you guys come together and think about it, and the stakeholders, and find out exactly what is needed. And as you grow during the course of, like you said, this year, right now we have 38. By the end of the year, you may have 78. I don't know. At least look at that portion of it and come up with some number you can present to the board that this is what we need to look at. This is our plan. This is what we think is going to work. This is the number of people we're talking about. And give us something that we can grab a hold of.
Yes, sir. Yeah, we can accomplish that.
I would agree with Marita's suggestion also, and Mr. Toffanelli, that, it going out to the industry, the sheriff, Mr. Wayland, and that, coming up with a possible solution to present to the board with some real-time numbers, sir. It sounds like it's going to be labor intensive for the cannabis department, getting all those CBCBs possibly in a short amount of time. So, Ms. Fullendorf, do you have any comments to the CBCB?
No, I agree with everything that's been said.
Okay. So I think that's pretty clear. Do you have clear direction on that one, Mr. Wayland?
Yes, sir, I do.
Okay.
Just one more thing, Mr. Chair. If I could request that, we get this done, maybe get something back to the board in the next 60 or so days that we can, considering the fact that it's going to be an amendment for ordinance, there's a lot of steps before it goes into active, and I would hope that we could make these changes so that people can plant their fields and know what the future holds for them.
Yeah, I would tend to agree. I mean, 60 days may be pushing it, especially going into a new permit process. If there's distribution, I think there's one other thing we needed to define, but we all brought it up. Looking at the distribution thing, was the board have appetite for the distribution thing? Because I don't want to just open it up for 100 licenses. At the same time, I think Peter and Greg are going to keep it within the confines of the EIR. Personally, I'm of the opinion that the distribution thing should be possibly open to the people that are currently cultivating, maybe open it up to a couple, 3 other licenses beyond that in the county, but I don't think it should be an outright, free-for-all when it comes to distribution. What types of zoning or, land uses is it allowed on? I personally think that anywhere we're allowing production, where I have the footprint for commercial buildings on, let's say, A1 commercial, just because, production building, they can be the same storage space as, let's say, distribution. And then there's one other thing I wanted to bring up that Ms. Galino touched on. Through Measure G, there's an added layer of revenue for the county when it comes to taxation on distribution. This is double up on by the state and everything else. I think that, I've been through the numbers, and a majority of distribution companies are failing. They're losing money left and right across the state, just for the very reason that we're compounding another tax on top of the other tax along with the state. We needed to have a discussion on just the distribution thing, on what the tax is and what's sustainable, and then make a decision as the entire board on, what can we do to make it so it's sustainable at the same time, but not at the same time give away the farm, so to say.
Mr. Chair, you're talking about distribution piece. And like I said, I'm not familiar enough with...
Your mic.
Mr. Chair, I'm not familiar enough with distribution. To me, it sounds like just something you do on this side of your desk instead of this side of your desk. I don't know what the infrastructure would take to do it, and I certainly don't understand the taxes. So I think I probably join most of us in wanting to learn more.
Yeah, I definitely want it presented to the board just so that we can all understand it fully. I've had a few people come forward with me, do presentations on what's going on across the state, and our percentage on the tax is unsustainable right now, compounded by what the state's charging and everything else. I said enough on it. Mr. Toffenelli.
Well, I have some questions of Greg that's going off on. Greg, can you remind me, take my mask off, can you remind me what the application fee is?
Roughly $12,500.
So it's $12,500.
And that's for the cultivation permit.
For a cultivation permit. And we've had 131 applications to date, correct?
There
From
have
your chart.
been...
I'm trying to clarify that because, one chart says 131, and then you go to your overview of application disposition, those add up to 167. So I'm trying to make, your last slide shows 131 with 59 to 69.
So, right. So in terms of the rights to apply being utilized, is that the
I just want to know how many applications have you charged $12,500 for the, how many people have paid the $12,500 for their application?
So the number of applicants who have paid the main application fee is going to be the 38 plus at least the 30 conditionally approved applicants. To get an exact number for you, I would have to look back at our records.
Well, the reason I question, and I know a lot of them are in process, and there's some work to be done before they get to the other side. I'm just questioning the $12,500 application fee as being maybe excessive when I look at the time, the $841,000 that we've collected and only $314,000 being spent, and we have an excess of over $500,000 at this point. Whether that's actually something, we're not in the business to make money. Obviously we're not a profitable business, but I'm just looking at that, and perhaps at some point when you come back to us in the next quarter review that you bring, or when you bring next, you can have some better numbers as to if this is an accurate fee. I know that they're some in process, so there's still going to be more funds expended for them to get there, that they've already paid for this application fee. But it just seems like we're less than 50%. We're like a third, like 30% or 35% of what we've taken in. I'm just questioning it, just looking at the numbers. If I was a business and I saw these numbers, I would be saying we're on a profitable side, but we're not a business, so.
And I appreciate that observation. There's a couple of things I would like to point out about that is from one of those charts, we attempted to show what the life cycle of this application process is. Some of them being, I'm counting in somewhere in the neighborhood of 10 to 12, almost 400 days old. And then looking down at the others, the process involves a period of time, and even those permits that we've issued around 180 days, the numbers, and on top of the timeline, the numbers that we were able to present on today because of the process of reconciling chargebacks and essentially completing our accounting so that we can make sure that our numbers are accurate. What you are looking at is a number as of the end of Q1 of this fiscal year. So it's less than what you're looking at. From what I see, because we haven't completed an entire fiscal year, it's hard for me to be able to tell you exactly how the end of this year will look, and we do revisit our fees. We will be revisiting our fees, looking at them, but I'm seeing a strong correlation, and to me, from what I've reviewed and what I've seen, the program and the fees are very sound, and there is a strong correlation such that I feel confident that we're in good shape as far as the amount of our fees, the amount of work that it takes to process these permits, and it's a programmatic fee that pays for our department. And so I will be able to come back as you proposed at a later date and offer you an update on that again so that we can take a close look at it and, if need be in the future, consider what, if at all, those fees need to change.
Thank you. I just wanted to maybe take a look at that and see where we're at. And you're right, this is not reflecting the whole year. Let's get through a full year and then look at the numbers and see where we're at and what it's taken and get an average of what it takes. You're saying 180 days now. Perhaps that'll go down to 150 days or whatever, and we'll see where it's at. I just wanted to point it out that maybe something that we can keep an eye on and check at a later date.
Yes, sir.
That's all I have.
I agree. Ms. Follendorf, do you have any other things to bring up? Are we clear on the distribution thing? Are we all in agreement as the board? Ms. Coway?
I'm in agreement with everything except putting in a restriction on who can and who can't at this time, because if you have cultivator A and they can distribute because they're part of the 30, and then along comes cultivator B, who is part of down the road, and they can't, and they have to get somebody from out of county to distribute it to their market. I don't know that that's something that at this point we should be putting numbers on. We should look at the whole concept of, as Mr. Garamendi talked about, is what does that mean? What does distribution mean? Are we all using the same terminology? I agree with Mr. Stopper, we need to look at it in relation to the EIR, but I'm not interested in putting that it can go to the people who are already licensed and maybe those in queue.
Oh, I may have misspoke, Ms. Callaway. I apologize. I meant everyone that has the opportunity to have a license for cultivation inside the county is what it's open up to. I think I probably misspoke, ma'am, and I agree with you 100%. Everybody that has the opportunity to cultivate in Calaveras should have the opportunity to distribute their very own product, and then maybe open it up to a couple others separate from that thing for people that don't want to have to go through the trouble of applying for the distribution license and going through another licensing procedure through the state. So I agree with you 100%. I apologize if I misspoke. Did I clear that up?
Mr. Chair, may I?
I think that's well spoken and well said, but the main thing is we direct Peter to bring it back to us and see what Peter comes up with. That may not be what Peter says is going to fit in the EIR. He may come back and say, hey, according to the EIR that we have now, unless you want to change it, we can only max out at 65. Let's staff bring it, and then we can have that discussion on numbers and so forth. Let's let Peter and his staff come back with what they can, what we have, and then we can have that discussion.
Understood.
I think Supervisor Topanelli actually anticipated my question, and I think maybe Peter's as well. I tend to agree with Supervisor Garamendi that it's good for staff to get as directed a direction as possible. So I think what I'm hearing now is that the board is interested in having staff bring back essentially an analysis of what a draft ordinance might look like and how that might fit in with our existing CEQA analysis, or what more we might have to do, what those parameters might be, as opposed to just bringing back a draft ordinance. Is that accurate?
Short window is what I think Mr. Garamendi's trying to say right now, if we're going to facilitate it for this season. So, there's, and we only have Mr. Moore for a short amount of time. So also, not that we won't possibly have someone good coming out.
Well, wait a minute. You can retire and then still come back and work for a certain amount of time for one period. So.
So I guess I think what Sarah is saying is that, do you want us to come back really very quickly with the study session that sort of outlines the parameters of what we can do, and then we craft the ordinance, or should we go ahead and review the EIR and craft an ordinance within the constraints of the EIR, and then take that through the hearing process of the Planning Commission and back to the board?
What's very quickly for bringing it back for a study session?
Greg and I will need to work together. There have been changes in state law since the EIR was adopted, or was certified as well, that will take a little bit of work to correlate between what the EIR considered and what is now a distribution license. I'd have to talk to Greg as far as a time frame where we can do that, but certainly within a few weeks we could at least outline what the parameters are that we can work under.
I agree.
Within a few weeks. I think that's reasonable. I think bring it back for a study session in 2 weeks with an outline, and then we can give clear direction as the board on which direction we're willing to go within those confines. Are you okay with that, Mr. Toffenelli?
Yeah, I'm fine with it, but the amount of time it's going to take before it actually comes back to us and we approve it, and then it takes 60 days to go into effect, could be more than what the majority of the board is considering. It might be better if you're in a hurry to get something done, have him and Greg craft something, and instead of a study session, bring it to us for our direction. Or before they do, or craft something and take it to the planning commission, and they can beat it around and come up what they think is appropriate. And then when it comes to us for the first reading, we can put our comments on it and then get it where it's supposed to be. And then you got to start the clock ticking from that point.
Yeah, no, that's absolutely the process, Mr. Toffenelli, you're right. I think that's the best suggestion moving forward. Ms. Fullendorf.
What's the impact with Mr. Mauer being retired? Will staff be able to pick up the ball?
I think so, absolutely. We've got a lot of good people that worked on this. Our county council's worked on multiple versions for quite a few years. They've had their fingers in it. Mr. Whalen's more than competent. I think, once more lays out a few things within the confines of what we're discussing, I think everyone will be able to pick up the ball and run.
So I think that's fine to start the process of just drafting an ordinance rather than come back to get further feedback from the board. It will just obviously be necessarily constrained by the existing environmental documents, if that's the direction of the board.
I think so. Personally, I see the distribution thing with, especially for people currently growing or people that may grow. We're already providing a facility for processing, or the ability for them to put a processing center in there. And I think that distribution could sit in the same footprint as that, in that sense. Anything beyond that, is up to the question for Mr. Moore, but that's just my personal perspective. Absolutely. Thank you, Ms. Edwards. Public comment? Or has everyone had? Ms. Callaway? Anything else? Ms. Fullendorf? We've kicked this one around for quite a while. Public comment?
No public comment at this time.
Okay, I could have.
I'm sorry, yes, we have a hand raised just now. Jennifer Smith.
Jennifer Smith.
Ms. Smith?
Dan, you're muted.
Ms. Smith, are you with us?
I think we got, I think we're going to take lunch and then come back for the final item. Yes. Ms. Smith, are you still muted? Because we can't hear you. Is she unmuted on our end?
She's unmuted on our side, yes.
Okay,
She
so,
has permission to speak. Okay.
yeah.
Okay, I,
Could she call in like we did? Oh, we had somebody that had to call in one time for the board phone.
okay, we have another public comment.
Yeah, Ms. Smith, we'll come back to you. Let's see if we can resolve the microphone issue. So the other comment?
Yes. Hello, are you there?
Do we not have a name?
This is Jennifer.
Oh.
Can you hear me now?
Yes.
Hi.
Hi.
Hello, Ms. Smith.
Jennifer Smith.
Oh, it's her.
Thanks for taking my call. I have just a few comments regarding distribution and testing. I'd like to dispel any preconceived myths about distribution and testing. Neither of them require big warehouses that are stockpiling or storing product. There's many ways a distribution model and testing model can work in this county. As an example, the primary roles of a distributor are to pick up samples that are 3 grams in size. That's less than the size of a handful. They transport those samples to the testing lab. The second biggest responsibility, or quite possibly the biggest responsibility, is the distribution center is responsible for collecting the state tax and dispersing that money back to the state. That can all be accomplished within 500 square feet. It is basically an administrative role. Now, some distributors do decide to have on-site storage and they charge for that fee, but local distribution doesn't have to follow that model. It'd be great if we could, but at this point, Calaveras is at a distinct disadvantage. We're the only cultivation county that allows cultivation and does not allow distribution. So there's no incentive for a distributor to drive past 20 other farms in other counties to come up to Calaveras and sell our product for us. It would be really nice if Calaveras could take that in-house, if we could brand it Calaveras County and get our product to market on an even playing field with other counties like Trinity, Lake, Mendocino, Humboldt, Santa Barbara. It is a very key element that we are missing, and to me really doesn't seem to have, I'm not a scientist, but doesn't seem to have a big environmental impact, especially if we put it into existing buildings or we put it into manufacturing zones where we already have processing licenses allowed, or if we're allowed to put it on our farms. For example, I could have 500 square feet in my dry facility on my property that's built to F1 specifications, and that could be a distribution office. Same thing with testing. There are not thousands of pounds of product stored at a testing facility. Most testing facilities are in office space where you drop off a 3-gram sample. I would guess at most there's 100 to 150 samples on site at any given time. Those samples are processed within 3 days, and the product is destroyed at that part through the testing process. So I wanted to dispel the myth and the fear, and hopefully the public can be welcoming, and hopefully our supervisors can get these 2 very important keys in the model in Calaveras for us. It's really a barrier to the market right now for us, and it's going to create disparity in pricing, and I think we're all looking for a successful model and a successful industry in this county. And with that, I'm always open to questions. Thank you.
Is there any other callers?
I have a Profana Smith. I don't.
Okay. Tell me when he's unmuted.
Unmuted.
Okay, I'm unmuted.
There you are, Mr. Smith.
Doctor. Okay, yeah, just a couple of quick comments.
First of all, we're definitely very much in support of stakeholder meetings. We look forward to that. I think it's super important. And as to the CBCB program, I'll be honest with you guys, I don't think it's needed. Sorry. And it's really rough trying to find people to work. 300 isn't enough. We've been looking for people. We found some, but we just feel like it's an undue burden on businesses. And then the next comment related to that is, can the department release contact information of those who hold worker CBCBs so we can reach out to them and offer them work? Because right now we don't know who they are other than through word of mouth. On the future, I would like to ask you, I understand the caution, but I do hope you will consider manufacturing in addition to distribution and testing. And I know that for some people this is a boogeyman, but it's not that big of a deal really, and I'm referring to the micro business license. The state allows a license that encompasses up to 4 of the licensable activities under a single license, and I would hope that down the line, when we do have manufacturing and maybe and distribution, that it'll be possible for a business to get a single license under a micro business provision, so they don't have to pay 3 fees or 4 fees to engage in micro business activities. And I'm referring to cultivation, distribution, manufacturing, and maybe delivery, although I'm not necessarily thinking we want to hurt our stores allowing that, but definitely manufacturing, distribution, and cultivation. It would really help us if we can have all 3 of those components under one wing. And that's all I have for you. Thank you so much.
Thank you, Mr. Smith. Any others?
No other public comment at this time.
Thank you. I think that, the industry meeting with Mr. Whalen will give them the opportunity to discuss this. So I don't think there's need for answering those questions right now because they're still working through on what the possibilities are with that. Mr. Whalen, do we have clear direction?
He's muted. Mr. Whalen, you're muted. There we go.
I said, yes, sir. Thank you. From my standpoint, I have pretty clear direction unless Mr. Maurer has any need for clarification right now.
Thank you. Mr. Maurer?
And so just to clarify, you want us to work on an ordinance within the scope of the EIR and bring it through the system so that you can get the changes you'd like to see done as quickly as possible. Is that correct?
Yes.
Okay. Receive marching orders.
Thank you, sir. We really appreciate your hard work. I think that's it. You know what? We're going to take lunch, and then we're going to come back for the sheriff's item. Okay. Let's see. It's 1 o'clock right now, so we'll come back at 2. Is that good? Thank you.